The material that has been shared is to be studied diligently by all of you it will be used in tomorrow's session. So Professor Tayo is one that shared it and said you should please go through it so that the discussions we will have tomorrow will be more interactive, I'm sure. So in the timetable, you will see that Professor Palade is supposed to take us this morning, but she just told me that she had made her apologies to the management of this course. Fortunately, we have very eminent professors, and Professor Igumbor will take his session for how to go about the mentorship stages and progression that Professor Palade will take. So please, can we give a round of applause?
Okay, colleagues, good morning. Right, so we'll take the session this morning on. So we'll be looking at building collaboration in research this morning, and that will be the first thrust of my discussion. I will start out by a bit of more didactic engagement with us, and I hope to end up in the second part by really illustrating, giving real examples of some of the collaborations I have been involved in and some of the tools that enabled them. So we'll have that level of interaction. I do want to disclaim, I often pull slides from very many people, and I do owe credit to colleague Peter Khan in particular, who does a lot of work around collaborations and research and has written broadly in it, but also to Ara and Messi, who have developed great content in this area. But I would even start by, and this is all up, exactly what I want about. So I wanted to start by bringing out direct scripts from a really good book by Bosman and Boardman. And the script reads that, historically in the past, the mythology of science embraced the idea of a brilliant, solitary researcher who wrestles heroically with great scientific challenges of the day, and by dint of his own singular hard work and intelligence, he solves the problems that others could not solve. Now, like a lone soldier. But for many decades, that portrayal of the advance of research in science, technology, engineering, and mathematics, of this great man history. So if you think about Albert Einstein, Isaac Newton, Archimedes, Plato, that's been ringing truly hollow. It's kind of untrue. In their analysis, Bosman and Boardman showed that 90% of research studies are actually often collaborative. So that single author papers is increasingly non-existent, at least in the sciences, in the STEM field. We still see it a bit in the arts and the humanities, but certainly not in the sciences. And not only are they non-existent and much more reduced, we're finding that when you have team-based and collaborative research, they tend to give you more high-impact articles, things that get cited by others and often used more by others, as well as articles that translate to patents for their commercial use. They end up being works that are of true value. And let's back that with research data. This is a bit of a dated publication, and Katz and Hicks showed in 1995. What they did is they went to the Science Citation Index and they started looking for articles that had institutional collaborations. And what they demonstrate, which is the point I put, what they demonstrate, if you look at all categories of articles, some of them, they are doing their work in UK, Many of them, whether it's UK industry with international people or with industry, but the trajectory from the 60s is that there's been a steady increase in levels of collaboration. So articles are truly being more and more collaborative. Let's bring it down home to Africa. This is a really brilliant read if you're thinking about the science of collaboration. Anyacha wrote on regional and international research collaboration and citation impact in sub-Saharan Africa. And really excellent. What she did essentially was took the web of science and looked at the major databases there and looked at countries, 5 countries in sub-Saharan Africa, and profiled the levels of collaboration. Some of the data is really stark, and I thought I would share them. The first one is she just looks at Ethiopia, Ghana, Kenya, Nigeria, and Tanzania. And in this table, she shows the numbers of publications arising from these 5 countries. So quite good to see a high volume of publication from Nigeria. But remember what Prof. Salako discussed with us. If you do it per million population, you find that we kind of dwarf down. Okay? So the first bit there is that it's quite impressive to see that. And Kenya as well, quite a number of outputs. So that's one kind of general observation from her analysis. The second thing she demonstrates is that Kenya and Nigeria, Kenya and Nigeria have had wider and stronger collaborations than Ethiopia, Ghana, and Tanzania. And what she does there is, if you see the number of publications from Nigeria over the years from 2000 to 2019, so you see that on the X, you're looking at the clusters that they have had. So in Nigeria, the clusters are how they group themselves by research collaboration. The Z there, the Z column is showing the links that they have had. And Nigeria is sitting at a quite good number of links, as well as Kenya, compared to the other countries in this analysis. In terms of the number of collaborating countries, she shows again that for the 5 countries, the collaborations have increased over time. So as you see, the number of collaborations is labeled on N column constantly. You see that they have increased in all the countries. From Kenya in 2000, it started at 68 and it's grown to 160. In Nigeria, from 61 to 156. So impressive to see that collaboration is truly something taking swing in our countries. And related to the number of collaborations is the number of actual citations of the work. Now, why that is important is the citation is giving us an index of utility of the research work. So what the study is showing is that the more collaborative the work was, the more citations it got, and therefore the more kind of science use of the work. And so, very strong statistical significant relationship between collaboration and citation was demonstrated, and here she looks at the number of citations divided by the number of citations per paper, which would be kind of your impact factor. And finally, this is the last one before we start our lecture. And with that transition, okay, would you help me transition to the next slide? Yeah. Finally, she says, where are they collaborating with? Nigeria in particular, she saw much more collaboration from the global north and Nigeria. So you have all that volume of collaboration with the global north, so that's the US, the Canadas, and so on. And then Kenya had, and many of the other regions had some better collaboration with some of the southern partners. So collaboration is something that is truly happening although there is scope for even more collaboration given all its value. Now let's start our session. I thought I'll preface with some data. I will be back from being an epidemiologist if I didn't show numbers. So let's go to the lecture now. So we will transition from it. It's not more. Next slide. So the core of it is that research is truly becoming interdisciplinary. There's need for us to marry ideas from a wide variety of disciplines. And it's also the case that many funding agencies are indeed moving on to having research that have true translational value. So there's a constant ask in order to get translation that you work with others. They want to see multidisciplinary teams in many instances. Another thing driving it is this need for large data sets. So big data means, you need many more people to generate it, to synthesize it, to provide kind of depth analysis around it. And of the true, in our time and day, collaborations are actually easier to develop and to maintain, thanks to technology. Throughout the COVID-19 response, I interacted with so many people I'm still yet to meet in person. We've never had physical meetings and all of that. Yeah? So it's now possible on your Zoom and through all of the communication networks to really interact and engage with people. Next slide, please. Sorry, I will have to be calling on you for it. So for the purpose of our discussion, we will be looking at collaborative research really defined in this term, in the sense of having more than one researcher or one research team working together for a common goal. So that's the way we'll be seeing collaborative research. So it would have been people who would have otherwise been in disparate settings working on themselves alone. But in this instance, we're saying you come together, forge alliance in order to achieve a common research goal. Next slide. Some of the key things, and just thinking through how we establish this kind of collaborative relationships. One critical thing that binds you must be that common goal. So the common goal is kind of what brings the agreed parties together. So we'll come together because we want to achieve the one thing. And it's important then that every member of that team recognizes that they are important, they are critical, they are significant to make the common goal happen. So there's kind of an agreement that without the specific part of it, we would not be achieving our goal. And in that sense, roles and expectations truly need to be established. And sincerely, what that entails, much like we discussed with our mentors-mentee relationship, it relies on having, it must be based on trust, it must be based on mutual respect of each other, there must be tools for good communication, and very importantly, we must all have abilities to compromise. We can't always have it all in the way we want it all the time. So you need this kind of true relationships. And much like, you'll be counseled with marriage relationships. It's the same sorts of things. It's a marriage of sorts between you and your collaborators. Next slide. In establishing it, it's very important ab initio, right from the start, that you are agreed on a number of things. You have to be agreed on what the common goals are. What do you want to achieve? What is to be exchanged through the collaboration? What am I giving? What are you giving? How will we work? And what products would we be sharing? We need to fully establish that. The resources, the money matters, they tend to be very thorny. You need to spell that out and define who gets what, where, when, and so on. You need to be clear about the responsibilities and also the credit. Who will get the rewards from all the tasks. And absolutely clear around timelines, very important. So very much a gentleman agreement, there must be a handshake around what we really want to achieve. It's negotiating your collaboration. Very importantly, and some of the points I really like here, is that you want to deal with anything that would be a source of conflict. The more difficult, hard, elephant in the room kind of conversations. Try to bring them up as soon as possible and trash it out. It really doesn't pay saying, no, when we get to the river, we'll cross it. Because it really could get messy at that point. It's better you are outright with people and say, well, I know that the money would be an issue for us, so this is my idea about the money. And you spell it out from the start, because they often can be the true deal breakers. Next slide. Communications will be very central. You need to set out the ways you choose to be communicating. We'll be meeting every Friday, a 30-minute Zoom call to get updates. We'll be sending quarterly reports or monthly reports to the funders. The cadence and all that should be very clearly defined. You need clear bits of communication. Who will lead the discussions? How those will happen should come out very clearly. Next slide. Roles and responsibilities should be set out. Who will be doing what? Who will lead in different work packages? So many of the European EU grants, but also some of our American grants too, they get their work breakdown structure, which you looked at last week. So from your WBS, you're saying for this activity or this work package, NIMA would lead. For this package, this other person would lead. With very clear definitions of what the leader can do, what kind of powers he has, and what the other team players have to do. Next slide. Very importantly, and this comes also from yesterday, because this is often what many researchers are looking out for. You want to discuss your authorship plans. You want to be very clear about who has the right to publish. Okay? If I have a PhD student, can the person draw up his thesis from the work? If I have a master's student, can a thesis come out from it? You want to say who would do the writing, who would lead the writing, and what would the order of authors be? You want to be clear about who would go for the conferences. There's a major international conference, who would go and give the presentation? And what would the role of others be? Who should we be acknowledging in all of our scientific content? Okay, I have my CMD in my hospital, or I have my dean who has been very supportive of me. I always want him to be acknowledged. Okay, so who do you need to acknowledge? I have this group that has funded me. You need to be very clear about that. Next slide. Very importantly, and I wonder how much we think about this, and even within NIMA, what our structures are, for example, or your various institutions, or the IPs. So when you have things you would be able to patent and potentially even commercialize, how do you handle it? So out of this product, you develop something very brilliant. How do you handle it? And in my school in Cape Town, the University of the Western Cape, we started out with the University of Oslo in Norway. So this was early 2000s, really, in a small project in Cape Town, where we wanted to help middle-level managers to be able to understand how to manage their health facilities better. So we developed a spreadsheet, something like an Excel database. And we're doing head counts, just putting a few indicators. And we called it, because we started in 2 districts in Cape Town, we called it the District Health Information System. That is what today we have as DHIS. So the project grew. We started with 2 districts in Cape Town, we then went on to 6 districts, all the districts in Cape Town, then went to all 9 provinces in South Africa. And the growth of that project got so big for faculty within my school that we now had to develop with this Ensure and a group that was kind of like an NGO group called HIPS, Health Information Systems Program. So HIPS came out as an offshoot of that project with University of Oslo. Because of our purpose and ethos as a university, we said, no, we don't want to commercialize it. So we must make sure that that program is built on open source platforms and nobody's necessarily getting too much money out of it. DHIS is now used in 57 countries across the world. We use it here in Nigeria too. So that's an evolution. So you need to be clear with the partner, what's my vision? So what if University of Oslo was saying, wow, there's great intellectual property here. Let's go create it, make it today program and sell out, right? We would have conflict with them. So you need to have this kind of understanding and discussions because your good work could really lead to some IP generation. Next slide. You need to discuss this. Data management, data sharing, data ownership. Very critical. And you need to have a data sharing agreement, a data management plan all set up in your collaboration. And you need to say how data is going to be collected and managed and where the integrity of the data will be ensured. Who owns the data? Very important question. Does it belong to you in NIMA? If it was an international study, are you collecting data so it sits on a server somewhere in Canada or in the US? Or is it your data in country? Okay. When and how is the data going to be shared? What are the data security plans? And that's important for everybody because you are strong as your weakest link. So if you have Red Cap or one platform or the other, and one of the partners is weak, and somebody can get through onto your database, all of your data for your participants is then open to the public or whoever has broken in. So those are kind of discussions you truly must think about. So there's a whole conversation about this part. You think about this interface. This is my data, this is your data, and this is our data. You will need that kind of conversation. That I'm collecting additional data that belongs just to me, and you could do the same on your end, but this data we share together. So you could have all manners of discussions around it and agreement. Next slide. You need to discuss conflicts of interest. Very, very important because they have a potential of influencing the integrity of your research and the data you generate. And you need to be clear what sorts of conflicts does the partner have. The partner is funded by the government of Russia. Okay, so he won't be able to collect data or he's challenged in the way he can present data on war in Ukraine. So if your study was on that, you really need to see what that means and whether you still need that level of partnership. And you need to think about the conflicts that may be related to all of these aspects. The finances, professional, whether they're personal, or just prejudicial kind of challenges. You should look then also at facilities, equipment, and supplies. And there you're saying, whose lab are we going to be using? Well, we need to use a standard PCR machine. Do we have the same one across all the centers for uniformity? Who's going to buy it? At the end of it, where does the equipment stay? Do we return it back to some board? Do we donate it to the government? So you need to discuss all of those sorts of setups and see that you and your collaborators are all on the same page. In one of the works I will share, the prospective urban rural epidemiology study, we started that in 2005, and our plan is to have the study run to 2030. It's a massive population-based cohort study running in 27 countries. And we're tracking for chronic non-communicable diseases. Prophylaxis, something similar to what you all have been doing in Delta and other parts of Nigeria. And in that work, the partners sitting in Canada, McMaster University, they say, oh, we need to have the samples because we want to do particular tests that's in a uniform lab, but we need to get the samples in a particular order, or we need this device to be able to get some of the biological specimens. And we need to standardize that and share across all the centers. So you need to think about that and who is really in charge and provides all of the equipment and supplies. Conflict resolutions, these will happen. And you need to see that there is some kind of way around how to handle conflicts and what the mechanisms, what governance structures within the research enterprise will be able to oversee them. And they happen for a number of reasons. We are different. We're different in our styles and personalities. We're different in the approaches we take even within our professional disciplines. We sometimes misunderstand people, or we don't communicate well enough. So all these things could happen, and we need ways of resolving them. And it's very important that somehow within your governance structures, you are thinking about it and making provision for it. The other consideration is around institutional regulatory standards. You need to think about the laws, the rules that prevail in your own setting. So our country does not allow the shipment of biological specimens. A Madras transfer agreement in the order that you have would not suffice for us. You need to be clear about it. In our country, once you do a screening test, you must return the test results to whoever you have screened. The person you tested must have their test result. In the US CDC, we said with pepper money, once you do any sero survey, you test people and so on, not only must you return the result, you must make effort to link the person to HIV care. Okay? And so in whatever you're doing, you must add a step that helps to bring the person into care. Either you're providing them with the ARVs, or you're finding a way to bring them to a facility where they could get the ARVs. So whatever regulations and standards you would need to then comply with. So, very important then to say that there are several benefits of collaboration. That's clear-cut. And in a sense, collaboration is in the best spirit of science. However, collaborations kind of make us very vulnerable. They make us vulnerable to the actions and the inactions of your collaborators. It's really the case that you are as strong as your weakest link. And therefore, in choosing your collaborator, you need to think about a collaborator you trust, that is credible, and has the kind of ethos that you two hold. And you become true friends after some time. So choosing collaborators must be based not only then on scientific considerations. It's not just that the person is an excellent academic, a great researcher. That's not all. If the person is dishonest, could fabricate data and all of that. If the person is all about money when you are not. If you're both all about money, then I think that's good, right? So you need to really see how amicable you can have. And you need to develop the clear lines of communication so that you keep on in the conversation and in the talking. Okay, I have some references there. Before I would just take a little discussion, then we go to the more applied session of how this has played out for me. Paul Erdos, mathematician, I don't know if anyone's heard of him. Chebyskin theory, prime numbers, he did everything numbers. He's regarded as the most prolific mathematician that's ever lived. He's had over 1,500 publications, and he had an excess of 500 collaborators, okay, in several parts of the world. What was profound about him is he actually would go and visit his more than 500 collaborators. So Zoom and all that weren't too common in his time. Well, I mean, he passed on in 96 though. But, he would travel. He made that his thing. He would travel, he would spend time, have a meal, get to know his collaborators, know their wives, know their children. That was the nature of collaboration he did. And that added to how prolific he truly was. He's so good that in the mathematics world, there's something they call an Ehimario number. So it's a mathematical index of your collaborative distance from all others. Okay? And how does it work? Ehimario is giving a collaborator number of 0. If you have co-authored an article directly with Ehimario, you are +1. That becomes your Ehimario number. When you write a CV, as a mathematician, you say your Ehimario number is +1. Okay? And if you have not directly, that's Ehimario now, you've not directly worked with, you didn't publish direct co-author with him, but you co-authored with someone who co-authored with him, you become +2. On and on. Okay? So I'm thinking about in our own fields, we need an equivalent of the Ehimario and see our collaboration numbers, right? What's your collaboration number in relation to Prof. Salakor or so? We'll find somebody to throw in and pull it there. So I want to pause there and just end the first bit of general discussions and see if there's any interaction we should have before I give you some of the examples I want to share. So if you have any questions, let's take them now. Yes, please, Anne.
Thank you, Benny. My question, I recently had to collaborate with people in 2 countries plus Nigeria in the same week. And one of them just immediately asked that I should send the budget. It was, I think, a day or two to the deadline. We're still trying to develop the budget. And I didn't send it. I was taken aback by the very upfront asking for the budget, and she's far my senior. So in the budget, an example, it was about $800 for the PI and $300, $800 for 75% of the PI time, and $300 for 10% of senior collaborators. So that was a bit dicey for me because I was wondering, how do I send this budget? Was this person, like, a lot of this was going through my mind. Of course, we being well funded and sort of that fizzled out. But this is something that it's a collaboration I intend to keep because I want to do. And I'm really wondering how to go back and repair, because even when I sent back the reviewer's report, there was no response and all of those. So in terms of being open and knowing your collaborators, I'm just wondering, for people that we haven't had any prior working relationship with, how it's going to be difficult to know the thing. So what things can we tick off to just help us to know if, because in this stage you're going to be using your 6th or 9th sense. Thank you.
And really good ones, especially when it's money matters, right? So it's not, you get to know them, and with every experience, it's kind of iterative. So you kind of learn about how individuals respond to some of these things. But the good part is oftentimes the funders give you rough guidelines, right? So many of the funders are very adamant, and that's the funding part in global health, at least. They try not to alter the salary system of the local, of wherever the work is being done. So they don't want you to alter your salaries in any real significant way. You can get some kind of compensatory income if there's some inconvenience and extra things you should do, but your full-time equivalent, your FTEs, within your local setup is what you should be offering. So the bit of, oh, is she getting $800 a day, you getting $300 a day, that really is driven by your functional FTE, right? Yeah. Yes. Right.
I want to find out how
Okay.
did you know that? I mean, budget, you're still building the budget. There's so many things to budget. You that maybe wanted to know how you're justifying your budget and things. How do you just think is to look at what you're getting and what I mean, because the budget has to be properly justified, isn't it?
Absolutely.
So if you come up, that's why I'm saying so is similar something just happened.
Okay.
We're helping somebody put in a project for NIH, and we kept asking for the budget, and she was doing it with her colleague, and we kept asking, because if you don't do it, including you, including me, we will not get anything. I'm not sure she eventually shared it, but the essence was to, so that we can look into how the budget is justified. Because if you don't justify it properly, you're not getting. I think maybe towards the end, she eventually wrote it or so. Had to, start correcting or suggesting things so that we justify the budget properly. So you don't just ask me. That's your person you're talking about may have 110 grants that she's so from the trickle of 1 naira to 2 naira, it's okay.
Well, good perspective there. John, you want to say something? Yeah.
Thank you very much for the very informative lecture. I'm just wondering about this matter of percentages. So they said that the PI, maybe for 75% of your time, you get $800, but the PI is in Nigeria and is earning
$400.
whatever it is. She's earning, so they base it on 75% of $400. Then the collaborator is in Norway or wherever, and they say it's 10% of the person's time. But that 10% of the person's time is worth far more than the 75% of the PI's time. So how do they do that?
It's exactly the amount. So the idea is it's not an issue of kind of equality. It's an equity thing that in some sense the person in a high income country is already at that level of income. So what is constant? What is the same between you all? And this is how we justify it when I had the Funders Act. I would say what's important is we're not looking at your currency, your money. We're looking at your time. So it is your time that we're buying, right? And your time has been denominated by you in whichever setting you are for a particular amount. Every hour, this is what should be paid to me. On this project, I'm going to give 100 hours. So it will just be 100 by the time, whatever rate you have for your setting. But there is great inequality there because countries differ, and so I struggle with it now in Nigeria. So having moved from South Africa here, when I have to cost some of my works, I can't put my rates all the time. What I would normally ask for in South Africa. But I know that that's pushing myself down, right? Because I still must pay tax in South Africa for my income. So it's it's kind of it's a challenging thing, and you need to look at it. It's also this case, we just got a Gates funding where they are insisting, we're not going to pay anybody who is with the government anyway. So you can't write that off as a remunerative pay. They are kind of asserting some language around a stipend honoraria of sorts, but certainly not a salary, because you are on a salary already. So that's another thing to look at. But I do like Prof's point about why do you eyeball? Why is that you go straight to? That you're just looking at the money that accrues to you without the whole of the project thing. And when we engage with budget, we need to think about very clear justifications and how we break those down.
I was wondering,
Yes.
is it possible for institutions to have, okay, for instance, at the University of Ghana, they have what budget that people can get on a grant. So it's not more. Let's assume their lecturers collecting like $800, but on a grant as a postdoc, who is equivalent sometimes to the lecturer, it's about $1,200 or $2,400. So these institutions have this in place just for equity, like we said, but I don't know, in Nigeria, that's not obtainable. So I'm just wondering, is it possible for us as our institutions to try and bring this into play and, see how to liaise with our research offices to try and just sort of know how it goes?
Absolutely, and I think that's the way to go. I think people want transparency. It's this thing of everything is behind and not clear. There's a bit of opacity about how you do things that has led many of our institutions into trouble and not having good reputation with international funders. But if institutionally it's written as part of your staff, your reward system, remuneration system, that with international grants or with the standard grants, X amount of money is taken in, and this is the way it will be, it's used. And it's very clear. It goes through your payroll system and not just to an individual researcher's private account like that. It becomes clearer. So research offices, research governance in our institutions should certainly do so. And have a way. In South Africa, I made reference, I think I made reference to this article processing fee before. So every time you publish an article in a journal, the science office in the country gives you money. So we get about $10,000 per article. So that's significant, right? So so that money comes to your institution. Your institution creates a vote for you as a researcher, and that's what you use to go for your conferences. You want to buy an equipment, you want to pay your postdocs, your research assistants and all that. That's where you get it from. Many institutions won't allow you just go and draw down the money and put in your account, but it certainly helps you in the research work that you're doing. Now, funders and all that are happy to see that because there's a clear arrangement. We're not just we're not enriching individuals, we're building a whole research ecosystem. So that will be acceptable. So, we need to find ways of tightening up these institutional arrangements. Okay?
Another question on that.
Yes.
And this is not necessarily collaborative research, but research. If one does a screening program, one is obligated to let the participants know the results, especially the positive results, so that they can be linked to care. Then, but if it is a research project, and there is this, during informed consent, you're going to say that no personal identifiers will be used and all that. I want you to marry the two. I know that for many studies, there is enrollment law where you have the names of participants and their study numbers so that you can reach them. But how does it play out when you say that your personal identifiers will not be used and all that? Okay.
Right, and that's very good. Yes, so it's not too much of collaboration. It's more the ethics and the practice of the research. So, and this is very interesting. I'll start off back to the HIV world. In healthcare surveillance for HIV, in the area, so late 90s again, early 2000s, the mainstay source of information on HIV prevalence was what we were collecting from pregnant women attending antenatal clinics. So when they come in for their ANC visits, we would kind of survey them, we draw blood samples and go and test for HIV. It started to carry as anonymous, unlinked collection of blood samples, right? So we collect the samples, then we know that in this region, there's this amount of HIV, right? But as we went on, we said, no, but certainly you should improve it. And that improvement was driven by the fact that ARVs became more readily available. So it became quite unethical to say that you know that this person has HIV and you're not putting the person in care. And we wanted to push that mantra of getting more and more people on treatment. So in that instance, the sorts of ways you would do it is you got a particular patient ID. So you got a patient with a unique identifier of sorts, and you have the interface. So what you really want to ensure in your surveillance system was true case-based surveillance. So you identify the individual, or you get the patient from the facility or when the person presents from care, and you have the patient detail, like you would for any routine treatment. That information is then taken, and what you do is you delink it with what you send to the lab, but you just have a connecting code, correct? So that unique identifier is what you get back to for just the positives, and to link them to care. But it's something that in your protocol you need to be explicit about. You need to say exactly what you would do to achieve it. There are other bits where people have said, well, once we found positive in an area, we can just go to that cluster and administer whatever intervention. So that doubles the task because you found positives there, so you now want to go there and offer a general screening so that they have a chance to take the intervention. So you just need to be practical and see depending on the condition. In all instances, the solution should not be worse than the problem, right? So if stigma is going to be an issue, people will be killed because they are positive. You want to prevent that kind of arrangement. Thank you. Thanks, Mo.
Thank you very much, sir. I just have a question. How do you get someone who is unwilling to collaborate? Let me give you a practical example. I know of someone who over the years should have moved up. For some reason, they are willing to collaborate, and that somehow slows the person's progression. And you see this person who should be mad of you, but you are willing to collaborate, hence is moving at a very slow pace, and you really want to how do you get around that?
That's tough, man. That's tough. So how do you get a woman who doesn't want to, unwilling to marry you, Okay, so it's hard. I think in reality, like you are pointing out, is you can see the stagnation. You really don't achieve too much. So with teams, together everybody achieves more, right? That's the idea of teams. So again, it's constantly educating, talking to them about, can we do this work together? And finding why the person is really not wanting to collaborate. As he had very bad instances of work, but I can't imagine the type of work the person does. So in this instance, is the person what? A clinician, a lab person?
A clinician, and also an academician.
Interesting. So the person will collect his data himself, analyze the data himself, ask the questions, write up himself. Yeah. That's a tough one. Yeah? I don't know if we have local instances or ways of doing that differently. But you truly can't force things. It's showing them the opportunities of whatever collaborative network. If they want to tie in, then that's easier. I thought your question was going, how do I persuade somebody to collaborate with me? Not necessarily this person, try to help the person collaborate. So somebody who's doing fine, you want to convince the person that I will add value. But yeah, I don't have a direct answer for you on that. It's not.
How about the other scenario you just mentioned?
Good. So it's posing your value, right? It's your value proposition. And I think that's where everybody is here. So you want collaborative networks. You want to build and break into collaborations. So that's really what we want to achieve. So it's constantly making a proposition on, putting yourself out there, being good at what you do, to writing or publishing so that you are known and people will then identify you for what value you bring in. I want to also share a few examples, and maybe these will bring a bit more issues on collaboration, because this is really what the experience I do want to share. So I've thrown out on screen 2 international collaborations, and I want to describe how the architecture of them have been and what I think is working and not working. So this kind of lived examples from my end, and 2 national collaborations. And I've purposely chosen Nigerian instances so that we bring it home. So since coming back in 2019, the collaborations I've had locally. And then I will show 2 major international ones. The first one is the Global Burden of Disease Study. I wonder if anyone's heard of that before. Great. So again, in the early 2000s, Christopher Murray, Alan Lopez, got commissioned to do work around burden of disease with the WHO and all of that. And they developed, this disability adjusted life year. There's a measure they call this DALIS, and out of that initial work. And it was analyzing, trying to say, what the burden of various diseases and injuries and all that across the world. And they put a metric where they looked at premature deaths and life lived with disabilities and added that together to come up with this DALIS measure. But importantly, they had to kind of gather information because we needed to know how many deaths were happening across the world. In that type of global health research, it's rather impossible to actually do it alone as one researcher, because you can't sit somewhere, wherever you choose in the world, to the center thereof, and be able to gather information from Nigeria, from Tanzania, from different parts of the world. So it became really, really difficult to have done it without getting collaborators. So they reached out to several known, at the time, public health, MPs and all of that across the world, and started asking them to contribute to a network. That grouping has continued and has really been growing over time. Today, the GBD has over 7,000 researchers. So when we publish our articles in Lancet and all that, if you see the list of contributors, of authors, in one paper we were over 4,000. Okay, in the capstone paper, right? So it's a massive list of authors. So oftentimes we actually just publish without putting names of the GBD Collaborators Network. So, and then as on the appendix, you now have this very extensive list. So it's really extensive. It's pulled out currently. I pulled this out from their website just this morning. Over 7,000 researchers from 156 countries and territories who pull data from different conditions. Now, these researchers are contributing by bringing in their data, putting in context to interpreting the data, in many instances supporting the analytical model and the assumptions being thrown in. They've started doing local burden of disease groups, where they sit in local teams in countries and they're able to look at their own data, review it, and provide sound commentary on it. So truly massive grouping. So how are they managing it? Sitting in the IHME, they have a whole secretariat, a real staff that is now addressing this network. So they know every researcher. Well, as you sign up on the portal, they get your details. They will share with you information periodically. You know, there's constant communication. They're asking, they tell you what the next project to be done will be. They will say, well, we are now looking at analyzing data on liver cirrhosis. Collaborators, people who are interested in this, would you come in? Now, there's a difference here in that it's not often primary research data collection kind of thing. It's often secondary analysis of already collected information. So that makes it somewhat easier, but nonetheless, you now as a collaborator have to contribute to the analysis. So you will comment and say, well, the data coming from Nigeria is from an information system that has these particular gaps. So we can't truly trust that it captures this. Or well, in the Northeast, there has been, a bit of uncertain situation where information on liver cirrhosis was never gathered. Oh well, we don't actually have a clear diagnosis for liver cirrhosis in Nigeria. So you can make all of these sorts of contributions and help them to improve their work. So it's a really good group. It's shown how we can gather lots of people and get one clear effort to have a complete picture or more complete picture of the burden of disease in our countries. We had a bit of problem a few years ago where researchers would then be listed as authors. So if you go to Google Scholar, and Prof. Salako said he would do, they send you your name and he would search on Google Scholar. Particular people, no real intellectual contribution to content, they get credits for some of the papers. So you type their name and it pops up because they are listed as collaborators somewhere. And so they can almost claim authorship of the work. And the team raised it up in one of our collaborator meetings a couple of years ago, and we now reviewed the way it will be done. When a lead person driving the work comes on, they send us the first draft manuscript, and you must provide reasonable content or comments to that manuscript. You must provide, there must be justification, and they have this ICMJE criteria that they will tick off to say that, you are now qualified to be an author. But it's been very good to boost the numbers of articles of many junior researchers and emerging people in low and middle income countries. Earlier this year, at about May, June, Africa Center for Disease Control got a grant from MasterCard that allows them to now do the strengthening for African countries. The team will be in Nigeria in the first week of November, and they are looking at building collaborators that can work in this network. So there is a call, there you go. The next slide. So there's a current call for collaborators. So you just need to go to their website and sign up if you want to be a collaborator, if you're in this area of work. If this is something that really interests you, you could sign up to be a collaborator of this network. You learn the tools on how to support burden of disease analysis, and you get a chance to start writing really high impact papers with them. Some of my highest impact papers have really been through this network. It's a constant reference. People use them quite a lot. So very good group, quite transparent, they're very organized, sitting out at the Institute of Health Metrics and Evaluation, and they've been doing some really good jobs, especially now that they are strengthening local burden of disease estimates. I'm looking at colleagues or other faculty. If there are any reflections on these guys, if we're familiar with them. And
I listened to the two people in GBT. There's this new CUGH, Global Health.
yes,
So they have a university.
right.
And so they presented their work. That was in 2019. It was fantastic. And we have a few of our colleagues who are involved. Mayo Wawolabi, Rufus Akiemi, Adepiki in public health. So they've been involved with GPD papers. And when you look at their series, each of them has about 40. So many papers on stroke, neurological disorders. So fantastic group to work with. And it's good if you are interested in it. It's a way to start or to be involved in some collaborative research.
Absolutely. So it's definitely something really good to look at. One of the areas I have strength in is in kind of small area estimation techniques in epidemiology. So basically, you have data at big level area, you want to drill it down to small areas. So I will create models that enable us to do that. Look at things like HIV prevalence incidence, which is where much of my work has been. And with this group, we developed models to be able to get at local government areas for our 774 local governments in Nigeria, good estimates around HIV. So they had their geospatial models that we did on 5x5 areas. So we can tell prevalence, incidence, and all that of conditions at these areas. So that's one group to consider. I will leave my slides so you can get the address properly and look at signing up. There will be a workshop by the Africa CDC in Abuja in early November. So if you do sign up a good time and you want to make it for it, that would be good. So that's one. The other, if you just help me, the other international collaboration I wanted to share and reflect on how we did it is the prospective urban, rural, and epidemiology study. So I started my work in EPI, really in the field of non-communicable diseases, and did a bit, sorry, did that move back? So with this, we had a very senior cardiologist at McMaster University, Slim Yusuf, who started gathering a couple of us. We joined in 2005 in Cape Town, but there were other teams that had started this work much earlier. I think they started in 2002. And the idea was trying to develop a cohort, population-based cohort that spanned different socioeconomic regions of the world. So from low-income countries to upper low-middle-income, upper-middle-income, and high-income countries, and allows us to really understand the true drivers of chronic non-communicable diseases. So like you see there, we were present in a variety of countries. So that's us in South Africa. We don't have anybody in West Africa. We've got Zimbabwe, South Africa, and Tanzania. So one of my big drive, and then Prof. Lassie and my mom, I've been trying to see if we could have established PURE. My mother, Professor Medical Microbiology, but does work in Louvain, retired now. But we thought we could use what you all were doing with the diabetes work to develop it. But more recently, we've also seen teams that run the health and demographic surveillance side, and Professor Mary Meku was here, the one in Calabar. So looking at all those sorts of groups that can apply our protocol and start the cohort. But it's running late because we have money that takes up to 2030. The Canadians are happy to give us funds up to 2030. But so you need to join now and quickly catch up if you can get ample data. So it's a prospective cohort, and we ask a lot of a number of questions around it. Please, transition. Let me just see if I can point on some of the key things. So again, so far we have over 225,000 participants where we have very detailed information on. So we've done all sorts of measurements on there, from anthropometry, spirometry, ECG, we'll do some blood works. So we've asked several questions, several research questions drawn from these people from all these countries. One very phenomenal, one good work we got out for those in pulmonology and lung function. So because we're doing among healthy people, we looked at lung function values in different parts of the world. So the physiologist here, so we were able to give new dimensions for calibrating FEV1, FEV2, because one size doesn't fit all, right? So your lung capacity in the Asian bloc must not be the same in Africa. So from large studies like this, you are able to get what would be normative values that you can then use to recalibrate some of your investigations. So we're doing really good there. Oh, okay, it doesn't move. We're doing really good work there, and across our various sites. It's urban and rural. That's typically what we'll do. And we've been following these people up. In South Africa, we've been following up 2,000 people in Cape Town and another 2,000 people within the Eastern Cape of the country at the rural site, and we've been following them up since 2006. Okay, so every 3 months we go to them, run a questionnaire, take whatever measurements we need, and periodically we do some other physical measures. So massive collaboration. Now imagine the kind of money you need to do this. Yeah? In the early stages for me, all of my research money went to it. I've had several, in excess of 20 master's students. I've supervised work on it. I have 2 PhDs that I've got out of it. Several postdocs have worked on this work because it is, big, large, collaborative research. They give us seed funding, we try to raise our own funding out of it too. And that's the way we've done. Lots of studies could really be embedded within it. Okay, so I thought I would share these 2 examples of international collaboration that I'm part of. Now let's come home. Let's look at Nigeria and some of the nuts and bolts of what we have done. I've spoken for almost an hour now.
Yes, hour.
Okay, I don't know how much more time we have so that we can yeah. Let me know what to skip.
We have to stay 10
Okay, so another 30 minutes. Okay, I think that should work. So I'll just take us through this last set of presentations, and we'll look at some of the nuts and bolts of building the collaboration. I've drawn the slides from while I really served within NCDC and how we built the Nigerian COVID-19 Research Coalition. Okay, so 27 February 2020, boom, we got our index case of COVID-19. But prior to that, the NCDC from January had already started being warned about, seeing that COVID was coming. Chikwe Yekwazu was the DJ at the time, had gone to Wuhan. He went to the very site. He was part of the WHO mission that went there. He got back and all of us stayed away from him. And but we all had to start thinking and preparing to respond. And at the time I was consulting for the United Nations, and they then said, Andy, why not go and join the NCDC and support them in the response. I was to take a number of hats, support surveillance, support that and that, but we said, this is so novel. Research must drive our understanding of our action. And so we started hashing at the time what we could do in order that the Public Health Institute in the country was responsive. Research is not the core mandate of the NCDC. NIMA has that mandate. So yet we must be developing, we need to be evidence-based, we must be doing operational research to understand what is happening. So that precipitated the need to kind of develop some coalition. And in the spirit of true collaboration, we needed this also. So I'll speak about how we kind of orbited the giant air ball and how that so happened. I draw that from Gordon Mackenzie's book, How to Orbit Giant Air Balls. But but it's quite interesting because he talks about the hairball and maybe just go to the next slide, how you could do it without being sucked in. So this is exactly what we wanted to achieve. I showed Chikwe this picture and he said, yes, that's what we want to do. We don't want to be tied into the air that they start calling us the Research Institute, but we want to be able to reasonably circle around it and still have a very good time about what we do. Next slide. So that's NCDC, really the three centers that we have, and the act that defines NCDC has that as one of the things to do. It says our mandate is to conduct, collate, synthesize, disseminate public health research to inform policy. So it does say research in our mandate in the act. So it gave us a need to start doing something around COVID-19 research. Next slide. We've had several times, we constantly do this interaction review where we say, how well have we done? One of the good things we did here is we try to be a learning organization. We constantly want to evolve and get better. So every time we go back, do these reviews. And one of the strong things that came out, even with the WHO, was they really commended us about our partnerships and collaboration. That somehow we've been able to work with everybody. And I think this NCRC illustration is one of the examples. Let's go on. Next slide. I want to move on. So one of the things we then did was to set up a Nigeria COVID-19 Research Coalition. And that's the website of the group. And I want to just talk about how we went about setting it up and how we operated in building that collaboration. Next slide. The objectives of the NCRC is first that we wanted to identify research priorities for COVID-19, building on the World Health Organization roadmap. We got some tranche funding from WHO, so we've always needed to make reference also to them. So building on their roadmap for their research priorities, for the global research priorities, we wanted to domesticate it, get a Nigerian specific research priority. We wanted to develop a 5-year national COVID-19 research agenda, which we ultimately did, and then identify human and material resources that could implement the agenda and really see that the agenda gets implemented. Next slide. Okay, so that's our office. Fortunately, Tech Fund gave us, quite good office space, really good. So I sat somewhere in a room just there. Sorry, the pointer is not on. So good office in the Tech Fund building. Next slide. Did you skip a slide before this? Check. No. Okay. No, yeah, that's fine. No, that's fine. No. So, never mind this interesting graphics. I didn't put this together. So we took all the thematic areas. So one of the first things was, what do you want to talk about this novel virus, right? So we looked at the WHO roadmap and identified some of the thematic areas. I think the battery's low. So some of the thematic areas that the WHO was looking at. So it was a whole range, trying to capture, the whole of the waterfront, so to speak. So from virus natural history, transmission and diagnostics, we looked at animal and environment and looking at that human-animal interface, to epidemiological studies, to clinical management, characterization and all that, to candidate therapeutics, candidate vaccines, infection prevention and control. We looked at the social sciences, we brought in ethics, and we also added the health system component. How do you respond within the health system? So we thought that was quite comprehensive to cover many of the aspects that were urgently needed around the response to COVID-19. Next slide. So we needed some formation, some structure. Okay, so this is collaborative work, so you want to build this kind of structure. So we'll switch slides. If at any point you need to stand up, you can stand up and stretch. I'll wind up quite soon. So we're then past 2. So in terms of how we structured it, we said we needed a steering committee that had the heavyweights in many of our lead health research organizations within the country. Then we needed an administrative arm, because you always need that. You need kind of secretarial support, people that help you with your corporate branding, but also sending out mails, reminders, scheduling your meetings for you, pursuing payments for travels, and ensuring that people get paid and things like that. Then, because we were research, we needed a very strong scientific committee. So we defined that. We needed a strategy, policy, and advocacy arm. We thought that was really key, and NCDC really insisted that that's the way we must go, because every work we do must translate immediately to public health action. And then, just to get real good validation, we thought we'd do external reviews. And peer review systems are very, very important. They are sacrosanct, have become at least sacrosanct in the science enterprise. So we thought we'd do reviews that will not just involve us, we have external reviewers. And then we needed a resource mobilization arm. And we had champions in each of those. So in our steering committee, for example, we got Professor Salakwa as DG of NIMA, okay, because they are the agency that is mandated for health research. He was the chair of the steering committee. And then we had the DG of the NCDC as the co-chair, because NCDC was largely convening it. So we had the chair and the co-chair, but Prof. Salakwa as our key chair. Then we got the ES of the Tertiary Education Trust Fund. They are the money people, right? So we needed them to come in. Any research we needed to do, okay, thanks. Any research we needed to do needed finance to support it. So we got the ES on the steering committee. We got the National Universities Commission. That was very thoughtful, because we wanted to make sure that many of us here could feed into this. So through the NUC having their ES in, we could get the vice chancellors, the DVC academics and research to be able to then get things down to our group. But something very good that we did, at the end of the day, we were hoping that our research would result in IP generations and things to be commercialized and so on. So we said, come on, we must get industry. Okay, so we got the Manufacturers Association of Nigeria on board. So with this, we ran the NCRC for the years that, for the periods that we did reasonably fine. What was missing, we tried but didn't get good feedback, was to get the Governors Forum. So our intention was to have somebody, because of our structure, that we have somebody that could get our governance on check and to be keyed into this. But I must say, all 5 people, sorry, bro?
There's no money coming out.
So we won't see them. But I tell you, they were all scared of COVID-19. And once you told them COVID, they kept running. Right. So I must say, all 5 of them, we had several steering committee meetings. They were constantly present. They were always with us throughout the period, and gave us real support, put their institutional support into things. Now, what did we achieve through the collaborations? And I chaired the scientific advisory group for the committee, and some really good science we got going. And here I illustrate just a few. So the biggest thing I thought we did around those thematic areas that I mentioned, we started out by offering, kind of stewardship about what was happening in the science, as far as, in as much as it impacted Nigeria. So one thing we did, we developed a national register of COVID-19 research, because we needed to start curating any research on COVID-19 that was done in the country. We wanted to know about it. We wanted to see if we had our people that could review the import of it and translate it immediately to policy. Okay, so we got medical librarians within the Prevention Knowledge Management branch of NCDC. They sat there and they were bringing all the papers. We got a portal where people should have submitted their research. Like question, did anyone ever know about this? There we go. Interesting. Oh, sure, Prof. Salata is well aware of this. And out of these, Prof. Salata has got us to try to do it now. We're looking at the register for all health research, not just COVID-19.
But there's something we did about that time on the COVID.
Yeah.
Because the register, the second register, that idea. Okay, it's not.
Right.
The study we did that, trying to use the CPAP.
Okay.
For patients to make them better.
Right.
And then we also looked at the health workers that were working inside the solution center.
Okay.
And the first part we published, the second one about health workers, I think is still going.
True. Right.
We did issues out there.
For Salaconate, yeah. Okay. Okay. So we sought to do that. So the register is still there, because I've been more removed from NCDC more recent times. I can't give a very clear update, but there's efforts to sustain that register and really build it into the least COVID database. Then we did the first, once we knew that we expanded our testing capacity, but we said no, we can't sustain PCRs. So we started works around validation of our various rapid diagnostic test kits. And there we commissioned groups, including colleagues in UI in the different parts of the country, and awarded some funds to them to be able to run validation studies. We also did the bigger population-based sero surveys. And we did that in 8 states, and we're hoping by now we have covered all the states. So those were massive things that we actually participated in. We started doing lots of collaborations around research protocols and publications. On our listing, we had about 300 researchers that worked with us on a variety of things and in all of those thematic groups. We ran our research days and research colloquiums in the periods we did. But bringing people together to think science, to think research, to strengthen what we are doing. Next slide. Okay, so I won't go through this in the interest of time, but every thematic area has something they have done. So viral natural history, animal, just next, epi studies, what they did, next, on and on. And so that's what the research register looks like, and researchers could have just gone in, log on, and put in their research, and on and on. Clinical research, just go next. Candidate vaccines, IPC, on and on. Now, from this work, we've learned quite a lot, and the need for kind of interaction between various. We'll go to the next, don't worry. Okay. And again, just emphasizing that we really must come together. You really achieve it, as that solitary, brilliant researcher. Next slide. Okay. Okay, so that was one. So what was there? There's a last example, and then I will truly stop. The second work of collaboration I want to share, and I do want to share very practical, because this had more primary data collection in a single study. It's a study we did, or we have been doing around evaluating the effectiveness of COVID-19 vaccines. And we're looking at its effectiveness, like the manufacturers have had, in preventing severe disease and death. So we're looking at severe disease as hospitalization and death. And next slide. And I mean, the relevance of this work is quite well established. None of the trials, the efficacy studies that were done on the vaccines really happened in the continent. The exception being South Africa, where they did a bit of test on Johnson & Johnson, for limited population. So we don't really have work on, do the vaccines work in Nigeria? Good enough, colleagues from NIMA contributed to a really impressive paper that appeared in Nature yesterday on vaccine effectiveness. I'm trying to look for who's in the room. I know Professor Idlechi was one of the co-authors. Right, a number of them, and they showed the immunologic response after COVID-19, after the AstraZeneca vaccine. Yeah, and it appeared in Nature yesterday. So very, very impressive. Yeah. So, but our study is different. It's not so much that lab-based. And next slide. In this work, we were looking at evaluating the post-introduction effectiveness of a complete schedule of the vaccines in preventing adults from getting severe disease and death. So what we're looking at is estimating vaccine effectiveness amongst them by the vaccine type, by the dose, by age, and whether they had particular comorbidities, the time of vaccination, and by viral strain. Because already we're seeing that different strain performances could exist. So we designed it as a test negative case control study within health facilities that were managing COVID-19 cases and testing people. And we thought we'd do it in the various geopolitical zones. Next slide. So that was the distribution. Through collaboration, we couldn't have done this as NCDC sitting alone or sending our researchers alone. We needed to collaborate. So what did we do? We got these regions, Sokoto, Usman Danfodio University Teaching Hospital, University of Ilorin Teaching Hospital, IRA Specialist Hospital in Edo. In Lagos, we got both LASUT and LUTH. In Kano, we had Kano Teaching Hospital. In the FCT, Gwagwalada, the University of Abuja Teaching Hospital. And in Enugu, we had UNTH. We were successful in getting on board quickly colleagues from the Northeast. We had strong discussion with colleagues in Bauchi, but ultimately we couldn't really get them on board. A very nice one. Coming together is the beginning, keeping together is progress, working together is success. Okay, next slide. So what's come of this vaccine effectiveness study? We got this app, we detailed our experience. There's a full article that appeared in Journal of Global Health where we talk about this study and what our experiences organizing and pulling the study together has been. But I want to show you some tools that were really important in our evaluating the study. Let's see the next slide, or just go to the next one, the tools. I want to show you first the memorandum of understanding, and I want to offer it as a template for you. And I want to show you our author's guideline, some of the things we had to do even as we organize the collaborative research together. So first, let's start with the memorandum of understanding. Yeah, colleagues, we're almost there. Do bear with me. Yes. It will be short. It's just showing the documents. And you have the slides, you have the documents. So let's start with the memorandum of understanding. So you need to think about this as you go into research collaborations. And you need to see that it's as holistic as possible in detailing all ways that, all manner of things that you need to deal with. We're fortunate in the NCDC, we have a legal department, and I'm sure many of our institutions do, that should really look at contracts before you sign them. If in your university you're just signing an international collaboration with your institution, being liable, that's not good enough. You don't do it just by yourself. With your head of department, with the Vice Chancellor's office and all that, you should have a system where it comes true that the university is embarking on that. So this is a legal document now. It's binding between us and the center. So you saw the 8 centers we had across the country. So we had this with them. So we'll say it's an MOU between NCDC and we'll name the institution. Go down, very legal. So between, like you see in normal contracts, we say you and the parties, legal language. So whereas the primary goal of the study is to evaluate that, so it takes all those sorts of languages. But I want you to appreciate what you must address in the agreement, in the MOU. So yes, you have all those legalese put in, what the study is about, what you're trying to achieve. Let's go to Article 1. It defines the purpose, why you are having the agreement. Article 2, you want to define the scope, what it entails for the various people, the partners to do. Okay, just go on. Article 3, the areas of collaboration, what we are collaborating about. As centers, it will help us to recruit eligible, you will help us to recruit eligible participants, you will help us to collect and provide data sets of the biological specimens, and you conduct the research activities as per the study protocol. Okay? Then, what are the modalities of collaboration? These are things we will be doing in the period. Go down. Okay? What are the actual methods? So we kind of describe and make reference to the protocol. That see what you are trying to do. You everybody age this to that. You collect specimens from them. You send the samples to the reference lab and so on. Now look at this. Article 6. We address intellectual property. Okay? Where the intellectual property will sit and concerning it, you need to agree with the institution. Article 7, you address confidentiality. So all those ethical, legal things that could come up. Confidentiality, you address it. Article 8, we address publications. How would we deal with publications in this collaboration? Article 9, we address funding. Who is going to be providing the money to undertake this collaboration work? Article 10, there's something they call this visibility. It's part of our legalese, but it speaks to that. Who would be the face of the project and so on. Go on. Article 11, the use of name and emblem. So can University of Ilorin Teaching Hospital just carry the study and put their emblem on it as though it's their work alone without putting the emblems of the other organizations? So you need to think about all of that because there's some credits and bragging rights that comes from it. Disclosure and publicity, next. Terms and termination. If you said, oh, I can't do this study anymore, how do we get that severance? Next slide. Next. The relationship of the parties, how we relate with each other. The liability, we mentioned it. Settlement of disputes, we'll look at it and then decide. So again, we'll put this on what we share with you. You can look at this material in more detail. But those are some of the things you should think about as you agree with collaborators around collaboration work. And you should think about it. Don't just take the words as they are. Is this what will work for your organization? And you project it. Truly the last, in 5 minutes. Truly the last. So in this one, it's another tool that we've used, and this is the authorship guideline we developed. So remember what we were talking about yesterday, who should be an author, qualified to be an author. We use these to clarify that completely. We developed ab initio, we agreed with all the site PIs, this is our authorship guideline. So what did we say? Well, that this guide will help us to define authorship for all scientific products. Scientific products are not just manuscripts. It's abstracts, it's technical reports, it's anything that you are producing out of it based on the data we've collected. So, what are the overriding principles? We mentioned that this guideline adopts the International Committee of Medical Journal Editors guideline for defining authors. Remember what Prof. Ezechi took us through, that you need this criteria to be defined as an author for the paper. Okay? So all 4 criteria, you need to fulfill them, so we point that out. And A2, let's go on. All those designated as authors must meet all 4 criteria, and all who meet the 4 criteria must be put as authors. So that's one principle. So these are our principles. The next is that individuals who do not meet all 4 criteria shall be acknowledged because for their contribution. All individuals who meet the first criterion shall have the opportunity to participate in the drafting, review, and final approval. Now that's important. So I like the case study given yesterday around Dan who was paid for the work. I keep saying I prefer that we are more inclusive, that we try to give them a chance to come and co-author with you. They were data collectors. Why not invite them? Oh, remember that work we did together? I'm now about to write it. Would you like to join me writing it? Why not? What does it take from you that the person joins in, you know? So I would have actually invited Dan, even though he was paid for it, to be a co-author. Oh, was it Peter? Sorry, I'm mixing up the names. Yeah, so regardless I was paid for it, you want the head of department in your department, why not? And Prof, oh, remember that work I told you I've been working on? Well, now at the time that we want to write a paper and all that, why not join me in it? I will work on the first draft, I'd like you to review, provide that. Why not? Be inclusive. It actually pays to do that. So, you know, and that's what we're ensuring. So this principle, A4, is essentially saying we will offer as many people opportunity to come and join us in authoring the paper. We will encourage collaboration and co-authorship with colleagues in the sites where the study was conducted. So you have these clinicians who are sitting in their sites, helping you get the patient involved that, and they never had a chance to contribute to works. You know, that's exploitative in my view, you know. So you should give, because we sit with the data, you know, we should give them a chance and say, we're now writing, come and join us. The NCDC coordinating team is responsible for identifying individuals who meet the authorship criteria. We needed that role definition. The criteria to determine the order of authors and to be listed of determined by the designated lead author. Because you are the one driving it, you are the one who typically will write the first draft, you would know how people are contributing. So you would then know how we should order the people that will be there. Okay? And because there's tension and different academic cultures have different interpretations for the relevance of corresponding author. In South Africa, we don't have much relevance really. It's just you that communicates with the journal. It doesn't mean very much to us. But over here, corresponding author means a bit to us because, of course, you are the one that people will reach out to. So that contact is important to you in that sense. Whereas, but in our time and day, when you publish your OG number is over there, once they click, they can find your name if they wanted to contact you anyway. So it really doesn't matter. Anything from our side, but you know, you need to see what is important there. Now, so we go through all those principles. Let's wind up. Although the correspondence is primary, it is expected that copies of all correspondence shall be shared with all listed authors. We emphasize that. So regardless that the journal is interacting with you, when they send you, a correction or a comment, make sure that you forward it. Oh, we just received this communication from the journal. They've asked us to do this, do that, and so on. So having gone through those principles, this is really the end. Having gone through those principles, we then say, how do we interpret it? And I really want you to pay attention to this. So criteria 1 says you must have contributed to the conceptualization and design of the work. We now say, how do you qualify? You have contributed to the conceptualization and design of the work if you were a listed investigator that contributed to the writing of the study protocol in the first instance. 1. If you provide technical inputs to the protocol or design through the routine meetings that we're having, because we're having periodic meetings, and you have been attending those meetings and commented. Or rather than doing dry blood spots in this order, can we do this? Rather than collecting just the information there, can we collect that? So if you provide that. We mentioned that site leads who contextualize protocol design in their local sites. That means you're part of conceptualization. Or for secondary or de novo analytic products, individuals contributing to the concept note or statistical analysis plans. Because although you said we're going to analyze for only vaccine effectiveness, someone may come in and say, oh, there's some vaccine safety information here. You know, we can also analyze this. That's a new conceptualization. So we recognize that. Then we say you must contribute to the acquisition of study data. Let's move on. So again, we define how you contribute to the acquisition of the study data. So it's very explicit. No one can argue what you're talking about. You have contributed to the acquisition of study data if you are in the site where the study is being collected. So you are either the site lead, a clinician, data collector, an interviewer, or the laboratorian. So we add everybody. You can, by that, you are contributing to data acquisition. Or you are the relevant state or health facility contributor like the CMD, state epidemiologist, all of that, because they all support acquisition of data. Then we go to the third criteria, contribution to the study data analysis. Individuals providing technical input to the development of the statistical analysis plan, and we developed one. Individuals directly involved in the analysis and management of the data that you actually did. You got on data and you ran the analysis. That's contributing to analysis. Then go to the next one. That's why we're really at the end. Contributes to the interpretation of the study. So yeah, we're saying individuals offer significant discussion of the results and of the analysis in the initial write-up. Because now we're interpreting the study findings. Or individuals who provide review comments which offer significant discussion of results of the analysis and thus allow readers to assess the manuscript's value and intellectual content. So we're very clear again. You must actually provide comments that put context in the write-up. Contributes to the drafting of the work and revising it critically. We're very clear about that. You need to have done that. Approve of the final version. In order to allow that, we need written. We'll send email to you. This is the version we want to submit, You must send your concurrent statement. If you don't, we'll write you again. See, well, we'll have to leave you off because we need this before we submit. So we have email written concurrence before your name is left on the paper. And then agreements to be accountable. In your concurrence, we have a standard concurrence statement that says you agree with the content and you'll be liable and all of that. So all we need you to do is just reply and search your name, and that is done. So colleagues, I think I can end there. Again, I will offer this document as an exemplar of a tool that you may use in your collaboration.
Thank you so much for speaking. Very enriching. I will not ask for questions. Several hands are up. We'll make our questions break because we'll have like a 30-minute panel discussion where the other eminent profs will briefly share their experience with collaborative research.
So, thank you very much, sir, for this great opportunity. Over time, I've been seeing, I would just see global body, 4,000 citations within 1 year, 8,000 and the rest like that. And I've imagined how can somebody enter something like this. So thank you very much. But I want to ask in the details, are there some other technical things that is involved? I've tried to go through the website and say I call for something, apply for something. I don't know if there are other things that we need to do so that we can, or everybody can just do it. Because I've seen a lot of people from the university where I graduated from that town, and you can see that within the 2 years that they joined the team, it makes a lot of difference. So that's my question. Then the one in South Africa that we are deeply involved that we talked about, how can we also participate in that?
So we'll take a round before, so that yes.
Thank you very much, sir, for the presentation. As you were talking, I had so many scenarios in my head that were just going around. And looking at this criteria for authorship, I would say that we are not listening to this, but I'm sure more than half of us are going to find it difficult to really assimilate and believe that this should be what we will follow. But I think, let me give a practical example, because I've been involved in a lot of collaborative work, which probably are very deeply involved. But I know that there are some individuals who will probably find it difficult to meet up to half of this criteria, but they still want them to be on the paper. Let me give you an example. Someone who was there when you were drafting the protocol, was involved in everything. Then along the line, the person stopped communicating. Then you go to the final stage, the draft is ready, you send the good email, and the person is the first to respond that he concurs that his name should be on it. You need to put the person's name and say. So I think having a document like this from the beginning will probably solve that kind of a problem. So that everybody knows what they are signing into. So that eventually when you are left out of the paper, you know the reason why you are left out. Because a lot of people find it difficult that when we were drafting this thing, like the stories we heard yesterday about all those Dad and Peter. Peter was collecting paper, they said you cannot be an author. And he said it's ethical. Because when you're talking about ethics, I think our own ethics at times has a lot of way to play so that we don't have people all want to look back because of God pointing at you with God, even his own mouth. Another example I want to give is what he talked about. I hope you understand my question.
Thank you, sir. So the case I have in my hospital, I'm the head of the department. So we have collaborators like 54G. This is an organization, but we have individuals. Someone attends a conference as usual, needs to network, and then he comes with the form that this is a research group. I will look at them as not like an organization, but of course research group is also an organization, and they also want to be collecting data, they want to participate in their research. What I keep saying is I want them to like give an overview. When we really apply to let's say research groups, not really an organization, can I give them an overview? So these are some because I want to make things formal with all the MOUs and authorship, so that at the end of the day, in the case of Coloros, who is a researcher in Nigeria, just collect data and send to them without really any benefit at the end of the day. Thank you very much.
Thank you so much, sir, for your presentation. I want to ask, the MOU, is it prepared by a researcher, the institution, or a lawyer? This is legal than I want to know who exactly prepares the MOU. Then my second question is concerning this COVID-19 vaccine. At first, we had that it was first dose, second dose vaccination. Then we had a booster vaccination. Now we have a second booster vaccination, which is 4 doses per person. I remember there was a scenario where I had somebody I used to, when I was about to take my first booster, I asked him to let go because we went together for the second dose. So when I got to him, he said, give them, let them, you won't carry their disease. There's no vaccine, there's no COVID-19 again, there's not taking the booster vaccination. So I want to know your take on that. Thank you.
Okay. So why not, let me just take this so that I don't leave out anyone. So maybe we'll just start from the last set of comments. So the first bit you asked was who prepares the MOU. In our instance, I drafted it from what I have used previously with other collaborations, but passed it through our legal units within the NCDC to see that it was okay. Now, NCDC legal units very happy with it. Say, okay, we'll now adopt it as a template to be using for this sort of collaborations. I really suggest that within your institutions you find you should have legal units in our school, universities, and so you should find what the right channel must be, including who the right signing authority must be. So if you saw that I couldn't sign it, it has to be the Director General of the NCDC that would sign it. There's an institutional agreement between NCDC and its partners. So anything could happen. I'm not with them right now, right? Yet the binding agreement still exists. So that's one thing to note. I will give you the template. You are welcome to use it. You are not doing any, you can just edit it, do what you need to do, and edit adapt as you need to, and just see that it's fit for your purpose. So it's just stating different aspects to things. On the vaccine work, can we take that offline? It's not too core on this bit. So let's take the vaccine work offline and what we're learning about vaccine effectiveness. Then just coming to you, sir. So just recap on the real thrust of your question. I want to just make sure I didn't miss that. Sorry about that.
Thank you. As I said, we have collaboration with 54G,
Yes.
which is a bigger organization.
Good.
But we have colleagues who attend conferences and then they come back with some papers saying we want to join research networks, individuals. Some are overseas and then maybe they have their offshoots in Nigeria and then they say, okay, it's led by, let's say, NAMA or Lagos University Teaching Hospital. That's where the country PI is, right. But we want to join them too.
Sure.
So do I also give the MOUs like I give with the project?
Right, good. Yeah. So whether you're doing it with individuals versus organizations or institutions. And so the MOU I showed is a very formal thing that is institutional. If you want to make an arrangement, so assuming I want to collaborate with a colleague within my department, I don't need to start creating that institutional MOU. But what I'm doing rather is just setting a level of interaction and saying, defining all the aspects. So my suggestion is, with such an individual, it doesn't have to be this written out kind of MOU, but it's a meeting with them where you would cover all those things that are in this MOU and you document it somewhere. So you send a recap email. As agreed regarding this collaborative work we want to do, we agreed on that. So what you use this MOU to do is to guide you on some of the issues you should cover. Publication, intellectual property, confidentiality, the scope of work, you cover all those areas in the email. But it's not one where you now start signing in that type of way. It doesn't get as formal. It's kind of a semi-formal arrangement by email with the individuals. With institutions, yes, signing, it's countersigned, you put your official stamp and things like that. So that would be the difference. I think that was just the one question. Then we come to you around the, is that you? Yes. So around the GBD, good network. I think in the website it tells you what you need to have, the requirements to be a collaborator. Once you meet those requirements, sign in and you will usually be accepted. But what does it take in practice? They will send mails, you need to act on them. So they are asking questions, review this material, look at the data set, and look at it, provide inputs to it. So just meet up to whichever task that they ask you. That's really what is required. And be responsive. They send mails, respond as well. It requires different skills. It requires sometimes very analytical skills. Sometimes it's kind of just your research and thinking skills. Sometimes it's writing. It's sometimes validation. If the team doing the work is in country, it could be some data mining, data cleaning, but they give you the tools for it, and you really develop. I'm sure you find it rewarding. On the pure study, if you're in NCDC, we can talk offline. If you're in NCDs, non-communicable disease research, that's what the focus is. So we can talk offline if it's something you want to pursue. Then to you, sir, I'm really wondering why it will be so difficult to implement the criteria. Because what we're doing here is we're very inclusive. We're not pushing people away. And I think that collaborative spirit is what we all need. So we're inviting people to come and join in. So, sorry, can you just show those 4 criteria again? you will see that it's actually easy. It's a bit easy to, but it's not. You must have all of them. It is this or this or this and this or this or this. You know, so there are ways you can easily pull them together and become an author. But why not the change starts from us here? So even though some of the people before us and so on, you know, have always insisted on being on papers and so on, why not you take it and start saying, so if you go to the very top, it says this or, good, yes, there we go, this form, good. So you can say you have done either substantial contribution to this or to the acquisition of data or interpretation of data and So it is this or this, either this set or this set. You don't need to have done the two to fulfill criteria 1. Criteria 2 is you must revise. It makes sense that you should read the work that you are saying you are the author. You must approve the final and you agree to the accounting. So it's something that many people will fulfill, you know, if you really think about it. So, but very important, again, take these two, you are free to take it, put it in your own study language and use it. That's really why I've chosen to share it. Okay.
Thank you so much. And just to add to what Prof said, if somebody contributed so much to the conceptualization of a study, when you're continuing with the study, I think the onus is on you to ensure that that person is also part of it. So that when you're starting your write-up, you said, oh, we are now starting the write-up. I have written a few things. Could you go through that sort of thing? Instead of saying, well, the person dropped my thoughts, and then the person can revise, the person can give ideas. You know, it's not that the person must, if you wrote 50%, the person must write 50%. So that's what I think. Now this panel discussion, and we'll go to our eminent profs to give us the experiences briefly, ma'am. 10 minutes.
Thank you very much. Good morning, everyone. My day should have started with your guys, but how about right? Did that? No. Yes, I've had experience with collaborations, and I think last time we were discussing, I mentioned part of how I get into collaborations. One thing you must do is that you have to be there. You have to be visible. If you're not visible, because basically you have to have something to put on the table. For you to be part of the collaboration, you must have something to put on the table. If you don't have anything to put on the table, they also want to collaborate with you. So part of it is coming for something like this that you have come for. You have met a lot of people that are working, that are Professor Igumbor, a lot of people that are doing a lot of things. Going for your professional conferences, yes, because you reach the big names in your field. All right? Don't some people, when you say you're going for conference, they'll be looking at you that you're always traveling. That's what they call it, always traveling. You don't know you're working. Okay, so I've been up even since, was this Sunday I came? And every day we are here from 8 to 5 p.m. or 6, and I get home about 6, 7. Am I not working? You see? But they are there thinking that, I'm enjoying. So you have to be visible. You have to decide to be visible. I know that from way back, I'd always been interested in research. And one of the things that set me off was one of the comments made by a colleague, Dr. Bamboy, here in one of our conferences. So he said to me, Ifeoma, why is it that most of my patients here with kidney disease in Lagos are people from your area? That set me thinking, right? So I needed to find out why we have a lot of this. And luckily for me at that time, ISN has started, the International Society of Nephrology, has started this thing of having research grants, small grants, I think that time, well, it's a lot of money. That time I got $15,000 from them to run my very first one. That I was telling you people. I went to the field and I had gone to look at the urban areas. And when talking to the Igwe, that is the chief of the area, semi-urban area, you know, so he said to me that what I'm doing in the semi-urban area, I must do it in the rural area. And that changed the success of that study. Because it made it possible for me to see that there was a lot of kidney disease in the rural, which you could not explain on the basis of or whatever. Anyway, so from there, I got to be known with my publications. So people will see your publication and invite you to be part of the collaboration. As he was talking, I was just responding to one that they had invited us to bring our data and all that and all that. So I'm kind of including my younger daughter to lead that. And she has put herself up there for me to be able to do that with her. Because as soon as she started working with us, first of all, she approached me to be her mentor. That thing I'm talking about, you approaching the person to be your mentor. In fact, she tells the story of the very first time she came to UNTH, I was part of the people that interviewed her. And my body language was like, this girl cannot get up to much. Because she was coming from not such a good school and all that. But I don't recall, but this was what she felt. So she decided that she must impress me. And that she has done. And she is so good. Through me, she has gone to India and come back for training. She's visible. When I'm going for conferences, some conferences where she has to pass, she went to Ghana for me in September while I was in India. She has gone to South Africa for me while I was in another conference. And then, what was it? So in this one again, I have involved her. In everything I do, I kind of involve her. She's part of all the work I do. So that way, she's now beginning to collaborate with others. I got to India. It was her name all over the whole place. They call her Olu, 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 Olu. Oh, are you Olu? This is Olu, Olu. So she made her name there already. So collaboration is open for her. One of the girls came to me and said, are you Olu? And wanted to take photograph with me that she has been seeing our work and all that and all that. So what I'm trying to say is that you have to put yourself out there. You have to be visible. You have to be ready for hard work. But the other thing she did, I was going to go towards, as soon as she started with us, she made a database of all our patients. She has it, database of all our patients. And she updates it. As they come and you do investigations and do this, she will update. So not too long ago, ISM was doing this thing on looking at anemia and kidney disease. I wanted to use our data in the History Africa. They refused, right? Because he didn't fit into. So I used my own data from UNTH. So from the data she put together, so the two of us are part of that project. Have you seen it? Yes. So she's already put herself out there. So you have to put yourself out there. So that we don't have to, somebody doesn't have to be pushing you and following you. Not that we don't push people and follow. But if you bring yourself out, you're going to get a whole lot more. Let me stop, sweetheart.
Thank you very much, Professor Ogunniyi.
Thank you. Thank you very much. Professor Igumbor and Professor Dulasi have covered everything on collaboration. So there's very little to add. There is the African proverb that says, if you want to go fast, go alone. But if you want to go far, go with people. And I think you're all familiar with it, right? That's what people are going. And that says the essence of collaboration. The era of solo scientist is gone. It was said yesterday, it's always a dictum now. If you're a medical scientist and you write a single paper, nobody will believe that you did the work. And it's not possible for you to do all aspects of the study and get a complete paper out of it, unless you steal data. But if you find things out and and people do different aspects, and you put this together. Then you have different perspectives of a particular disease. It makes for fuller understanding of the condition, and you have a lot of papers to show for it. You can have collaboration in research, you can have collaboration in writing papers, you can have collaboration in funding and all that. They all get. So there's no way we can succeed in life at present setting for research and in education without collaborating with people. And I think I should just stop there.
Thank you very much, sir. They are open to questions, so at the end, if you still want to get clarifications or way forward, you can ask.
Thank you very much. It's good. I'll try not to repeat what others have said, but I felt I should highlight some other important areas just for the benefit of everybody. You know, collaboration is very useful, very important, but our attitude towards collaboration will determine whether we'll make a success out of it or a failure out of it, because collaboration involves interacting with one another. So I'll give 3 examples just to drive home my point. My career, or the career of everybody where I work, versus depend on collaboration, because we have to often come to the field to collect data and collaborate with people. So I've had to go to Cameroon, to move from scientists lab, from one lab to the other, trying to say, okay, these are the ideas that we have and we'd like to collaborate with you. And then we did that, in Ghana. And in the process, everybody will study your body language, and you have to understand whether the person that you are speaking with, are you able to really rely, because you will be over there and you have the idea and trusting that somebody is doing the work. So to drive that point home, our work in Nigeria, we work in Nigeria for some years, but at the point we ran into some issues, and it was like, we couldn't move forward. So that was when we got in touch with Professor Ogunniyi. I said, look, we needed to be able to move forward here to do something, but now, we are not moving further. What can we do? So in the process, he said, oh yeah, let's give it a shot. And we tried and initiated the collaboration. And he then said that, he was going to bring somebody on board to join him to do the things we wanted to do. And who was that? That's the DG, Professor Salako. He was the, I'm talking of maybe about 12 years ago or something like that. So, but the first project that we had, it wasn't with the big money. So just a small amount, and say, okay, this is this, $30,000. We said, okay, please, just for 1 year, let's just see your performance. That relationship has led to so many things, including the H3 Africa that Professor Olasi would speak so much about, and a lot of things. But there are times also that we have to just insist on some things that we may disagree to agree. So what am I trying to say here? Collaboration does not mean that all the time you smile. If you ask Professor Salako, he will tell you I'm a hard person. I said, look, I don't want it done this way. You must say, sometimes, so what about if you collect the data and after this, no, we don't. So that's part of collaboration. Then you also have to, in the process, also respect your collaborators. Everybody is an authority in his or own field. Nobody knows it all. And then you also have to recognize there's something that will be beneficial to your colleague. Make sure you yield. It doesn't have to be you and you and you all the time. And then don't look at the financial gain all the time. Because we are not politicians that you just go out and campaign. What campaigns for you is your paper, is your work. So the one manuscript or two that you get out of it will speak, and then if you do a good job, you don't even need to go out. Everyone, one way or the other, find you out. It's like when they say your sin will find you out. Yeah. This time around, the good work will bring others and say we want to collaborate with this person, and that's what is happening. I can't go continue to mention other projects that Nigeria is a small place, but then you see, we didn't get to know until the project and from one person to the other, and that's the way it is, extending to Cameroon to Ghana. So please, once you start it, first of all, don't think about it's time to buy pens. No, do a good job. Do a good job. Is that just, you may have to even spend out of your money to execute it, and in the process also try to be up to date. I'm sure people have told you about that. Thank you. Sorry, I think
so much, sir. Yes.
Good morning, faculties and colleagues. I'm Dr. Johan Osman from the University of Jos. For me, I think one of the major highlights, one of the major points or take-home points for me in this training workshop is idea of collaboration. I've had very interesting ideas that, and as a matter of fact, I'm looking at a few grants that I've secured. I actually sat down on my own to write everything from top to bottom, and then meet a mentor and say, please sir, I need to take a look at this. And then, it was very terrible. Realizing in this workshop that you need to let other people do other things, is a major thing for me. Now, I want to say thank you to Prof. Ma for what you said earlier about bringing something to the table to facilitate or encourage collaboration. And I'd like to say that to my colleagues, that most of the senior people, I've had to talk to some senior people to help me out to do one or two things, but the number of senior people that I'm working with today have actually said, you're going to come. Now, two very senior people in the Jos University Teaching Hospital had approached me. One, I was just walking on the corridor. I said, hey, you, come. I'm hearing you make presentations during these seminars. I think I like your energy. Things like that. See me in my office at social time. So I saw one of them and I was like, okay, I like what you're doing, what. I had a big grant from NIH. I presently operate what he described to me as the African Center for Excellence in Emerging Infectious Diseases. And he said, what can we do? I have some money to give you an idea. He's an infectious disease specialist. So I was like, oh, sir, I don't do microbes. My interest is human genome. He said, yeah, so what can you do? And then they said, okay, sir, I've been interested in this COVID infection, but I don't know about virus and things like that. But I know that there's something about the human genome that affects how that some people are more at risk, some people have more severe disease, some people die, some people survive. There's been so much gist about this stuff. I said, sir, I think I have an idea. There's something happening in the human genome that, and he said, okay, write something. I'm going to give you money to do that work. I'm still working on that. So I think if we have something, we have learned something, something we're passionate about, and we're able to talk about it and make ourselves bring something to the table. I've been listening, just as the boss has said, somebody, a senior person is going to identify us somewhere and get to work with us to do us and make us better. Thanks.
Comment?
Thank you very much for this wonderful information. It's actually an eye-opener. We are very grateful for this. Actually, before I came here, there's a lot of things going on my head, but almost everything has been cleared. Though I always keep asking myself, with all this information we are getting, we still have one more again. So it means that still there is other information to be added. So that gives me some energy again. So wow, definitely there's a lot of things to learn. So apart from that, we actually appreciate that. With regard to the questions, I have two questions. For instance, with regard to this issue of signing MOU, authorship and what have you. Assuming that now I'm just doing a call for a grant, for instance, I'm writing for a call and get collaborators. Is it that after we win the grant, then we come and sign all those documents, or right from the beginning? Because what I have a personal experience. There is one day I just saw an email from South Africa, one collaborator. She actually said that she wants to collaborate with me. And the main reason why she wanted to collaborate with me, she just saw one of my paper that I am working in social area. It was on patient morphology then. Then we start developing the proposal and what have you. There is nothing like anything like that. So though the proposal was not successful actually at the end, but that keeps on coming to my mind after these lectures, especially when you are making reference to History Africa, because that grant was not actually applied for History Africa as well. So there is nothing like signing this, signing that, and what have you. So now I start thinking, oh, is it that after you get the grant, then you start thinking of all these things, or what will it be? Then again, regarding the collaboration and mentorship, at which stage you are mentoring and you are collaborating? Or is it that when you have a mentor, it's already you are collaborating? Thank you.
Question? I guess any of you start.
President Google. Okay, well, you're on MOU.
And I like that. So at what point should you get onto the MOU? As early as possible. So assuming you can't sign, so you're not signing yet because in the proposal stage, because you've not got the funds, so you don't know if the activity will happen. So assuming you are not successful, the activity will not happen. So what are you signing to, because it won't happen. But the content of what you will sign, it would have been nice to have kind of briefed and kind of preempted your collaborator ahead of time. Oh, there is a call that has come out. Third one has made a call. Why not we go together and apply for it? You will be this, I will be that, and that is how we apply for it. So you've kind of spoken about it, and then when you win the call, you now break things down in very clear MOU standpoint. So yesterday, CIHR announced to us that we won the Canadian grant, the multi-purpose grant. Right? So in that grant, we've already got, we have teams within Nigeria and in Canada. We've already started talking about what we hope each person will do. So we have a bird's eye view arrangement on what contribution everybody will do. But right now that we received the award, so I will sit down now with Professor Aldo, and we now need to spell out in very clear terms, service level agreement with some partners, MOUs with other partners, we have to now define in very, clear terms. So it's always having clear communication, being together on the same page on what each person should do. And that's the principle. Okay, I think that was it.
Thank you so much, sir, for the clear explanations. I want to also ask, for instance, where I have a supervisor, we wrote up for a grant, we got the grant, and had to write up a preliminary of my study, which I presented in a conference. But when we were about publishing it, she took the first author and corresponding author, gave me second author. So do I make agreements with her? On when do I make the agreement? So what should I do?
Right. So this detailed authorship, I'm really thinking, and I'm looking at senior colleagues too here. I'm thinking that there's a strong indictment on our institutions to be more protective of younger emerging researchers and how we can do it. So me, I think it's the reward system constantly. In South Africa, and Prof. Salako mentioned it here, I was very happy to hear him say that. In South Africa, I don't get much credit anymore by being first author. It's exactly being my senior author, the last author we call senior author. Because the expectation really at my stage is that I'm pushing people forward, right? So I'm the one that I serve as the overall guarantor and senior author on the paper. So I'm often last. I think it's the same standard in the US and so on. So it's quite interesting that we see it differently over here. But nonetheless, I think we must find ways of clearly communicating these things, right? So yes, you have written up an initial piece of paper, and you're saying you're presenting the paper idea now to your supervisor and saying, sir, look, I'm working on this paper. I really like the content of it, but I don't think I've quite got it. I would like your input and so on. So if you negotiated it in the form that you are reaching out to him or her for their input to strengthen your work, do they still take it from you and become first author? That'll be my one question to you. The second one is, I also hope that the way we're narrating it, we're not being unfair to our supervisors. Because assuming it is my project, so you come to my lab, so I have an overall project, right? But then I could say, oh, work on this aspect. So you now begin to work on that aspect. But truly, the real conceptualization and write-up comes from me, because it was me that really did it. I've just assigned you a task to run with particular things, right? So the fact that I gave you assignments, okay, go and do this, go and do that, and then you pulled it together, does not mean really that you are the originator and owner of it. It truly doesn't mean that, because I can see that will happen with undergraduate thesis, because these people, the kids don't yet, they don't yet know the research, they don't get the design, But nonetheless, I think what our supervisors should be doing more and more is encouraging you to come up and find this. But I think let's
I could say one or two things. Okay. Yes. That used to be the pattern. Most of the institutions. In Ibadan, it was a big problem. In fact, it happened with legs. Some residents in radiology did some work, and then the consultant wrote the paper and was the first author. And of course, the person then took it to court. Oh yes, took it to court. And yes, you're holding your hands. When you hear some of these funny stories, you'll be surprised that some of us are still alive. So I want to have a time with minorities like that, chemistry. All happened when it was. So they have to set up a committee, a university set up a committee to look into it. Then the Polytechnic College, not only because of that, but many others, came up with the policy that supervisors should not publish the work of their students unless there's some prior agreement to doing that. And that's the kind of policy that people respect. But it's a kind of gentleman's agreement. It doesn't hold all the time. When you get your degree, particularly a PhD, then you have the stamina to challenge. But when you are still a student, it's difficult at that stage to challenge your supervisor who needs the papers for his own promotion. Otherwise, you will catch up with him or her when you come on board. So that's the usual affair. So the thing to do is do your work, go with the university policy on publication of thesis, and in Ehimario specify. Those supervisors should publish or be the first author of a manuscript emanating from the students' papers, at least first 2 papers or something. Thereafter, they can negotiate the rest. And that's the policy that we go by. But it pervades all aspects of learning, science, arts, or everywhere.
Sorry. Oh, please go ahead.
Yes, I wanted to read into this because maybe we are not giving the full perspectives. For us in medicine, of course, the impact too is part of processes of getting there. And one thing I've noticed is most of our residents, they not even have topics. They approach you. So I'm doing this work. I give you this topic. I have a typical example. I was doing this. As I give you the topic. Part of running the business, I contribute money to give them. I remember once we had one in Benin. It was running so much, and Prof. said, I said, Ma, see what I do. I put money towards it so that they can run it. So we all put money towards that particular project. So to this other one, we put money. So when we finished, no right, we decided to split the distance in 3 or 4. Everybody can write. You finish writing your first author. Yeah? So as soon as I took mine and finished mine, was first author, got it published. He quickly started the others. And at some point he realized I took another one and started. So he fast forwarded. So I left him to finish it. You see how it's poured him on to go on and write. It's not that I don't have the strength these days because I have so many residents that have finished, they haven't written up their work. And very good work. If I had strength, I would take it and write it. Because once you start and get work published, you will start rushing to finish it. So we need to have the whole perspective, not when somebody has put in a lot. For those, I make sure that this life is too short for me to start doing. Yeah, it's too short. But you need to, do something yourself. How can you finish your part 2 for 4 or 5 years? You haven't written it. It's not good now. It's not good. And this happens all the time. Because people were to publish, and so many of them are good data that one can use to put out something out there. If you go and finish and write, of course, I don't have any issue. First up all of it. Go with first up as a person. In fact, in some of mine, I make it first up because I really don't need it. But in some cases, I insist that I will be first up, like the chapters of books I write, because to write books or chapter is one. That is how you will be following them to the fact you end up writing the whole lot of it. Yeah. Because you finish your own aspect. This book will not finish theirs. It's not writing. You're there editing, correcting, and the publishers are on your neck. The publishers don't know him, but they know me. So it's on my neck. Right? Like these days, I refuse to write all those things anymore. Because they put you under so much pressure. The people you're working, you tell them, they say, oh, we're all interested. We're interested. When it comes to the, put hand on paper, wahala. So that's my...
Thank you.
Okay. I just wanted to add to it that always, as you do your best, also put things in perspective and in context. Some of the things may not be practicable because of the relationship that you have with your mentor. There are some fights that you just have to let go. It's not every fight that you have to fight. You have to run to be able to fight another day. So please take note of that and put everything in the context of also the culture and the relationship.
Thank you. I certainly think that most of, or many students in Nigeria may not really be aware of this terms of publication thing, like in the know. I remember after finishing my BSc and the person who was later, because I did it on my own, I didn't have any supervisor at the time because it was in a different field. And someone was later calling to just read through my work and he said it was good, I should publish. I had never heard anything about publish then. So he gave me a book, I think a journal to guide and all of those. I did and gave it to him, but never had any feedback up until now. And then during my master's too, my supervisor did this. I didn't really, I was reading articles, but didn't really know what it entails. So it's not something that is really in the curriculum or a prerequisite for, I think, faculties to really teach in a different institution, to my knowledge. And unlike maybe outside or in other places that it may be ingrained. Now, fast forward to this year, I have undergraduate students who seek to be mentored in research, in writing, and they are undergraduate students. And I said, okay, let's start some work guiding. And a senior colleague comes in and is very mad at me that these are undergraduate students, they need to face their studies, they are not postgraduate students, you don't have to do that. There are students that have met with me and I asked them to finish their first degree, and it was really mad. I had to seek an audience with the Vice Chancellor to ask him what I was doing was wrong. And because he had trained outside, he was like, no, and others. So you see this kind of thing, I had to withdraw at a time just to put myself together and really ask the questions if I needed to go forward with this. So someone said our supervisor, she said our supervisors need to be reoriented. I think there's a place of learning and relearning, and that we have senior faculties here. I think these are discussions that we should take, at our meetings, at our institutions, and maybe politely as junior faculties also see how to integrate this. It would really help the research space in Nigeria rather than the talk keep going up, and then when Prof said you have something you bring to the table, because we have not been taught to think, in-depth thinking of research and asking research questions. It's really difficult to bring anything to the table. So at times people's hands really have to be held to know what to do, and it can be very irritating for faculties that are outside. Even the way we rise to seek for collaborations and all of those. So these are personal experiences I've had, and I've had to learn even how do I write an email to someone seeking assistance, or I want to collaborate, that at times really dicey things for us to do. And I'm glad that we are having this opportunity, sort of like holding the hand process to really not just hear about it, but really telling us how to do, because the how to do, I think, is the main problem for us. Thank you.
Thank you very much, sir. Thank you, ma'am.
First, I think I want to use the opportunity to publicly appreciate Professor Shaye of Ophthalmology Department of UCH. I mean, if not for her, I'm sure I would never have published my papers. So she pushed me to publishing papers from my part 2 dissertation. I think that is something we should lean towards as supervisors for. Sometimes they can really be nice towards them in trying to help us achieve that. But I'm saying now that in order for us not to lose the significance of the subject matter for the dissertation, is it possible for universities to set a timeline, a time frame, between where you submit and pass your exams to when you should publish as a student? So that if at that time you have not done so, the institution has the right to publish that paper. With that, we will not lose the body of knowledge that sits on the shelves of most of our postgraduate colleges in Nigeria. Thank you.
It's very difficult for the university to insist on that. You have a right to publish, you have a right not to publish. You may feel that the material is not worth publishing. There may be other challenges. You might have used facilities that are not up to date. So a few things might prevent you from saying you want to publish. But if you are in academia, it's not all of us who end up in academia. You can do your study and then get into the industry. And you're making big money. So why worry about publishing any paper? That's the thing we sit understand. It will be difficult for them to say everybody must publish. The usual victims would like a postgraduate college. They advise them because also data has a lifespan. If you don't publish your paper, you will have the data collected 2010. They want to publish in 2022. The editors of the journal will tell you to please go and review your data. Maybe new things have come. Now, why didn't you publish it when you had the data? So data has a lifespan. So a lot of scientists know this, but people have a right to decide whether they want to publish or not. And sometimes, if you try publishing and it was rejected, you may feel because of ego issues. You feel that, no, who am I to write it and somebody says it's not good enough. Now I'm not publishing again. That can also happen. So we can look at it from both sides. But it's your privilege and your right to publish and not publish. Thank you.
I fully concur with that, Prof. Another perspective, though, is we're talking about publishing, and we're largely making reference to publishing in academic journals. Your thesis itself is a publication of the university, right? So many of our institutions actually have theses now digitized, and so there's a portal you can go and you can pull down all the repository of theses, So that in itself is some sort of standing publication of the university. And in the spirit of translational science, there's an ethical responsibility for us, and especially many of us who are in public health, to see that our findings are disseminated directly to those who need to know and use it. So the studies are really things that we need to have. So you're looking at the performance of the RDT kits. Who needs to have that information? The Ministry of Health, the CDC. So you need to see that information gets to them. And it could get to them not just in academic papers. Your policy briefs, your writing of other kind of materials are also very important. So let's also think about all these circles, all these multiple media of publishing, of getting the results, the findings of our research out there. Yeah, thank you.
Talking like an epidemiologist. In our own part 2, usually they don't include all those publications, but really, if you're writing grants, you have to include that bit of how you're going to disseminate your information, and it's key. You must put all that there, right? Because they want their information together. That's the whole idea of keeping the form.
influence policy or influence practice.
Has it been included? Is it out of place to include it?
Well, in time we'll get there, or with because our own is like the colleges are like universities. That's what it is. So we're not interested in all that for that. All those your part twos are in the repository. They are there. They are there in the repositories. I don't know if they digitize them. All the colleges are trying to digitize. So, yes. So in time, all those things will be digitized. And you can refer to all those. I refer to dissertations. Yes. You can refer to all those dissertations and provocations. Yes. Yes.
That will be the last question or comment.
Thank you very much for the. So I just want to lend my voice that the newer university coming on board now have tried to play around some of these things, especially in their postgraduate procedures. Before a student is admitted, you know that, for instance, in my university now, before you can graduate for a master's, you have to publish one paper. And before you can graduate for a PhD, you must publish two. And one of them must be in Scopus Index Journal. So you know it's the basic that you must do before Senate will consider your result. If you don't do that, they won't organize for final defense.
Thank you very much. Mentorship stages, progression and transformation by Prof. Ogunniyi. I think we're very privileged to have him here with us. So please can we give Prof. a round of applause?
Thank you very much, and good morning, distinguished colleagues. It's a pleasure being here to participate. And I'd like to thank the organizers for inviting me to be here. I thought that I was just going to come and sit and listen only to people like, it was only on Monday evening when I asked about the logistics, and then I realized that my name has been slotted for a lecture. Because the program with Dr. Q was Spidey, my name was not there. So if there are deficiencies, don't blame it on me. It was because of very little time to prepare. But mentorship is something I will talk about. Now, if you look at the program that is circulated maybe yesterday or before, they actually included what Professor Kadri spoke about and all this lecture. So I had to sit there and listen to Professor Kadri so that I didn't have to repeat myself in doing that. So we're going to focus on mentorship stages, progression, and transformation. But I would. Okay, that's the point. So I'll provide a short overview of mentoring, skipping what Professor Kadri has said. Then I'll focus on the stages. We'll talk about career progression and transformation. Then I have 3 cases that I think we can discuss and see what your perspectives will be on this. Closing remarks and then the acknowledgement. And I'm sure we'll finish in about an hour. How many of us have mentors? Let's start with that. How many have mentors?
Not structured.
Not structured. Okay, very few hands. How many are mentors? So not too, well, about 6 are mentors. But I think they are all mentors. And at the end of this training, we should all become mentors. And should please look for people to mentor. But that's the only science we do. So it's nice. Now I always put there this painting, Picasso. And this is the mother and that's the baby. And that's what we use to preach mentoring, like a mentoring a baby. This is from the GoFran from New York. And I always admire it. It's from the SCAT program, which Professor Fati is involved with. Anytime I talk about mentoring, I always picture that as you're mentoring something. And it's something you value very deeply. So this summarizes what mentorship is about, or mentoring. It provides training, it motivates, it provides advice, you see to the success of your mentee, of course your own success as well. You provide a direction in research, in grant writing, you coach the person, you provide support, and you have defined goals. Now if you are involved in the mentorship program and any of this is not there, then there is a problem. And you may then have to do an MOU as President Google has said. Go back there and see how you can incorporate this into it. Or what you can do to bring whatever is missing into it. So that's the way it is. By the time you finish mentoring, all these things must be present. And for me, picture is worth 1,000 words. This is what mentoring is about. That's the person lending a hand. And usually a gentle hand. And it's pulling the other person up. Some people say in Nigeria, some people put pins there and thorns. So that as soon as you hold on to them, you drop it very quickly. And you never fall down. And the second point is that successful people never achieve their goals without mentoring. They never reach their goals alone. So the mentor is there at the peak, and this is the mentee that is climbing up. And you can see the hand is there to pull him up. Some people say what we do here is rather than giving a hand, we push down. But I think we as mentors should not do that. Now, there was an issue about mentoring lasting almost forever. And it's there. Good mentor-mentor relationship may last beyond the formal training period. But roles evolve. So you can see a mentor, then imagine as a mentee. And you are happy when your mentee takes over from you. You can sit down and say, thank God for that. I have a few that I can use as an example. One is Professor Salako here now. He was with me before as a mentee, but now he's a mentor in some respect. Another is Mayo Labi, College of Medicine. He was former dean, so he was before me, trained under me as the senior registrar, chief consultant. Then became, and I had to sit and listen to him at meetings. People say, sir, sometimes you want to get something done. So that's the way it goes. Rufus Akemi is another one. So they started as mentees, but they are not big mentors. Akemi has put together the largest, my area is dementia. And that's when we started in 1991, when we got our funding from NI for 20 years. And then it's gone continuously since then. At that time, Akemi and Mayo were students. Now, Akemi has emerged as the person who's compiled an African consortium on dementia. And he recruited me to be a co-PI with him. So this is how it should be. So and you should be happy that your mentee has reached that stage where you then come under and you are happy to make him succeed. That's the job. If you haven't reached that one, then you haven't succeeded. And that's the point. So I thought we should start from areas where Professor Kadi didn't cover yesterday. Let's look at mentoring challenges in low and middle income countries. And this from a paper was from a workshop organized by the Fogarty International. And then they came out with a manuscript published in American Journal of Tropical Medicine and Hygiene. And the scholar was the lead author in that. So we have scarce and limited mentoring training. But things are changing now. In the last, I was becoming Professor last, in the last 2 or 3 months, there have been at least 3 sessions of mentoring and craftsmanship training that I have had. There's one in Abuja, we have one in Accra, Ghana, and this is one in Lagos. So things are changing. So it's getting better. And that's why you are lucky as a group. When we were doing our training, there was nothing like this. You have to, like they say, find your way through the bush. You know, the thorns and all sorts of things to get to the other side. But we survived. So it's good that these opportunities are coming now. It makes things better. Professor Kadi emphasized the second point yesterday, cultural factors. We respect the older person and seniority. They can't be wrong. And if they say something, you can't challenge it. I'll again use my own example. Professor Salako, when he's referring to some of the old professors in medicine, we refer to us as the owners of the department. That if they took any decision, if the owners of the department were not present at the meeting, then you have to represent it and wait for their opinion. So for us, when you mentor people well, you don't need that kind of waiting. They know your views and they can push it further. But this is our society. We also respect age. So we differ rather than challenging. And that actually affects our scope in science. Because rather than being critical, just say, oh, the boss has said it, why bother? But that's not right in science. So we're very dependent, and that's another point. There's no institutional support. In the US, and I think Professor Tayo talked about this later during the discussion, they have offices that oversee grants, mentoring, and all that. And if that is part of your calling, then you must do it very well. For here, we do it on top of our workload, and it's never recognized. And that's a challenge. So institutional support is the problem, and of course we don't utilize it for promotion. So we just do it almost like a gospel job, and you expect your reward to be in heaven. And sometimes you never know whether the reward will be there or not. So those are the challenges. So these are things that we should do at the end of our mentoring. And if again in your mentor relationship you are not achieving this, then again you need to go back and look at the things agreement you signed before. We must encourage our mentees to speak, and I think that's the most important thing. Communication is key. So if you're in science and you don't speak out, Sorosoke as they say in Yoruba, and in Lagos, that's the Sorosoke thing that they talk about with NSAS. Yes. And today is 2 years of NSAS. Yes. Today is 2 years, I know. In fact, they're having a rally in, around the gates. So, although they stopped them, but I think they will still contain. So, your mentees must be able to speak up. If they are just there passive, like zombie, then you are not achieving anything. It's not helpful. You must learn to communicate with passion, with compassion and empathy. And there must be constructive feedback, not just saying that what you are doing is right, and then go behind to say, no, don't mind wasting his time. You must be able to provide feedback that will help the mentee to grow in their career and whatever they are doing. There must be assistance with goal setting. We'll talk about individual development plans. And then you must assist them to be able to implement the strategies and the plans that you both agreed upon. You must help them to develop competence in all aspects of grantsmanship, from proposal writing, through carrying out the study, dissemination of the results, and policy engagement. You will notice that a lot of things that Professor Igumbor said related to engagement policy. Because if we do our studies and we don't translate the results, then it's like a waste of time. So we must be able to translate our results, and this is part of the mentoring training. We must embrace diversity, religion, culture, age, all that. And we must help to find opportunities for funding. These are key points in a mentor relationship. There are more. The mentee must develop self-confidence, and there is nothing more challenging in science than lack of self-confidence. You go to a meeting, you ask you a question, and you start stuttering, or you start looking down, and you can't even defend the data that you have. That shows that maybe you didn't do it, or you cooked the data. But when you've been well mentored, all these things will become natural attributes that you have, and that's important. So we must also help mentees to take increasing responsibilities. We want to foster independence, and you can't foster independence if a person cannot take responsibilities and be able to stand on his or her own. So those are challenges. So it's like translating the mentoring competencies into realities now. That's what happened on this slide. So you must also be able to balance your personal life and work so that there is no burnout. So that's the other problem that people face. No work-life balance. You work until something happens, and then we realize that we've been spending too much time in our work and not enough time to cater for ourselves. So people develop heart attack and all sorts of diseases, even cancer, because they neglect themselves. They also lose their families. But we must know that there is a time for work, there's a time to also live with family, and we must develop that. So those are things that good mentor-mentor relationship must achieve. Of course, you must apply the accomplishments of your mentees. Some people feel bad that their mentees are better known than they are. But that's the essence of mentorship or mentoring. You want to make a superstar. who can supersede what you've done. Then it's at that point that you're a great person. And then you must provide training beyond just the academic calling in administration. I mentioned that Olabi, who moved from clinical medicine to become the dean, so he was in administration, probably will become a provost or CMD or something. Professor Tepa, who is currently CMD of the lab, was once a mentee of mine. And when he became mentee, the first thing he did was to come to my office and to say that they should redecorate the room. He said, he did that for Professor Kali as well, just two of us in medicine. He said, to appreciate his mentees. And so we benefit a lot if we do all this. And if your mentees get on administrative positions, you also benefit indirectly. I'll let you to one or two secrets. Anytime I'm going to Abuja, I never call no. And he says there's a driver waiting for you at the airport. It's true, all the time. Emmanuel. The last time Emmanuel was going, we went for exam in October. Emmanuel was going to bury somebody in the village. And he said, no, I'll get the next driver, who's very responsible. He said, he must take you. He said, oh, that's he's coming to Abuja and he must be there, of course. And that's the kind of thing. So, and Tunde says, oh no, sorry, I'm calling him Tunde. Yeah? When he became professor, I said, Professor Tunde Salah, he said, please, never call me Professor Tunde, I'm Tunde Salah, come to you. So, when I do this, so Tunde says, it's payback time. And that's what he tells me all the time. So, anytime he comes and says, it's payback time for my boss. And I say, no, you are the boss now. You know. It's fine. So, enjoy all that. Okay, so let's go to stages of mentoring, and I think we will just slide away through this. So indeed, there are 4 stages. The first stage is building the relationship. The second one is exchanging information and setting goals. The third stage is the working stage, where you work towards the goals and deepen the engagement. And the last stage is ending the mentoring relationship and planning for the future. So we're going to take this one by one, and then we'll put examples and you see how it benefits. Please feel free to stop me at any time. And if I say something that you don't agree with, please also raise your hand so that we can debate this. I think that's the purpose of this improvement in communication skills as mentor-mentee relationship. And I think it's fine. And I don't mind that. I like to learn from people. So let's start about building relationship. So the first thing you want to do is for the mentor to learn about the mentee. What skills the person has, what the interests are, and what the goals are. You want to build trust, and that's key in mentor-mentee relationship. You must build trust. Then the most important one is the first meeting with the mentee, and that will determine a number of things. And then we'll talk about how to schedule the meetings and how you'll be communicating. Somebody talked about remote mentoring yesterday. Of course, COVID has helped us. Now, Zoom is the order of the day. Lectures, conferences, most things are done through Zoom. So there's no problem at all communicating through whatever means that you have. So we start with self-discovery. The mentee must take some time to look at themselves, analyze themselves, if possible, dissect themselves out. What are my qualities? What are the things I need? How do I do all this? So reflect on whether you have mentors in the past. What had worked and what did not, and see how you can make amends and correct this. How would mentorship be beneficial at this time? Is the next question you want to ask yourself. You must have planned goals and how to get there, and what you think you want to benefit from a relationship. There's no point going to a mentor-mentee relationship without having a clear endpoint in mind. How do these benefits align with specific growth areas that you have? So it means you must know areas where you need to grow and how you can use somebody else's talents and experience and connections to get there. And then you determine your needs and then say, yes, I need a mentor. If you sum it up and you don't see any clear need for it, then mentor relationship may not really be beneficial. So you must be able to answer this at the beginning. So how do you select your mentor? You know what you need, and you know what you want from a relationship, you have clearly defined objectives. And then you identify what the obstacles might be for reaching your objectives. Maybe you don't have time. Maybe you are engaged doing another program, like a PhD. Some of us I'm a clinician, so you may be busy with clinic work, but you are also registered for a master's, MPH, or a PhD, or whatever. How will these new things, new studies you are embarking on, how will they interfere with your time you have for a mentor-mentor relationship? You have to give thoughts and be able to articulate what you think a mentor will assist you with. So you must have all this defined. And how do you want to reach your objectives with or without the mentor? So it's not that once you have a mentor, you give up and the mentor does everything for you. You must also have some things to do. A key word is being purposeful and pleasant, and you must have challenging goals. One of the friends of Professor Ogunniyi, who was listed as one of the authors, but not here, is one Collins Haringboa. He says you must define your goals and you must dream very big. And he quotes the former president of Liberia, Salih, that if your dream doesn't scare you, there is not big enough. So go back and sleep and dream again. And that's the way it is. So you must dream big. And otherwise, one will be stagnant. So when you dream big and imagine how you can get there, that you're climbing a hill, and that's what the relationship is about, which was what I started with. So pulling somebody up the hill, not on the playing ground at all. But please remember that never take advantage of mentors' goodwill and confidential information that they provided to you. So make sure that you don't take people for granted and you play your own part. I think those are key points in mentoring. So how do you find a mentor? This came out yesterday. I think you asked the question for Professor Kajun. How do you find a mentor? Talking about collaboration, Professor Igumbor also mentioned that. How do you find someone to collaborate with? It's the same thing. Finding a mentor. Usually your researcher, and Professor Ulasi said it too, that be productive. Have something to put on the table. So don't just do it passively and say, okay, the mentee or the mentor will provide all the answers for it. Have something to offer. And that's the only time the person will be excited to say, okay, I think this is a useful material for mentoring, and I can help this person get to the next thing. So research is important. Collaborations which we spend the money to talk about. So networking, that's the other point. Be in a group and ensure that you're very visible. And there's a quote from one of my mentees. This is Albert Afalu, who used to say that he's the Secretary General of the West African College of Physicians. He says, be keen to be seen and be seen to be keen. You go to meetings and people see you. Who's this young man who is all over the place? Asking questions and helping with this and being in various committees and all that. So it's important. Then the will be mentor who say, yes, this is a material that I consider very useful and important. So look at the mentoring history of the person you're going to. If the person is abusive, then you want to avoid that. If the person looks down on others and says, oh, they are no good, there's no good scientists here, there's nobody I can work with. I'm too big, I'm the best. It's very pompous and arrogant. And that's not the kind of person you want to. So the history is important, the trajectory of the person, job performance, interpersonal skills, and the ability to teach. Those are key points that will help. Then, if you have some grants, they have mentorship built into it. SCAT is there, UMFPJ is there, Stamina in Jos, Brains in Lagos, HBNU, which is I think the US university, they have in groups of 4, Harvard, Boston University, New Mexico, and Northwestern University. They have together HBNU. There's also the Global Brain Health Initiative. They have mentorship built into their training program. In fact, with the HBNU, they might suggest mentors to you if you are working in the same area. They look at your proposal, they look at the perfect fit from the list of possible mentors that they have. And if the person accepts you, of course, sometimes you may say, would like you to be my mentor, and the person declines. If they have too many on their hand, again, you must be clear how many you can take. Don't take more than you can chew, or don't buy more than you can chew. That's important. Of course, the last way you can find a mentor is that serendipity. A chance meeting, maybe at a meeting, at a lecture, and that works. And this is where I always remember the French expert, Louis Pasteur, who says, fortune favors the prepared mind. And that's always important. So be prepared. It's like having, each time you're talking about mentoring, think about your 1 minute pitch. You have 1 minute to interact with somebody in the elevator. And you want to get your message out quickly. So know what you can say that will catch the person's attention and say, yes, this is the person I consider a good mentee or good material that we can work with. So you need a perfect fit, mentor and the mentee. This is based on compatibility in terms of complementary abilities that you have. Maybe the person enjoys working till about 10 p.m. or whatever, and you love that too. Maybe there's a reason you're in the same field. You have some commonalities in terms of what you're doing. Those are the things that are important. Commitment is important. Both sides must be committed. And then there must be mutual respect. And those are key things. So these are questions you must ask yourself when you reach this stage. My mentor will make a statement like you must speak to yourself, expectation and assumption. My mentor will get me a promotion or find a new job. Possible. But you don't go around starting with that first. You must have done something first can find you a new job or get you a new position. My mentor will give me clear advice about what I should do in a situation. I think that's important. My mentor will act as safe and confidential sounding board. That's also very key. Confidentiality is important. A man with a body of knowledge, so sounding board, which is important. Not the person who will go back to single-minded young man who's come to me. He doesn't know anything at all. He's a dollar. That will put you. My mentor will teach me so and so skills. So if you're looking for skills, mentoring in skills, that will be fine. My mentor will introduce me to so and so. This is for networking and for collaboration. So those are things that will guide you in getting the right fit, and you need that at the very beginning. This is building relationship. Then in some societies, particularly in the United States of America, there is something they call mentoring compact. It's a kind of agreement. We don't do that here. I remember during the UMFPGA thing, we introduced our mentees at that time that they will have to sign compacts. And some of them said, no, this will be a binding agreement which they don't want. And so they don't do it. But if you are being mentored in the United States, most of the universities have their compact. And we usually ask our fellows during training to look at either University of Washington or University of Pittsburgh compact. So you can look at this, mentoring compacts. So these are agreements or documents where mentor and mentee agree what their commitments are during the time they work together. The compact sets expectations, streamlines communications, highlights the goals which must have been identified, and deadlines for the interaction. And this improves efficiency, but things are specified out. And this should be completed at the first meeting. So during that first meeting, these are the things that you want to talk about. What are the expectations? What are the goals? What are the means of communication? What are your commitments? How will I help you? And what are the limits? Where will you cross the red line? Those are things that will be defined, and they are always stated in the compacts that we sign. What do they cover in these compacts? Purpose and desired outcomes of the mentoring relationship. The timeline, you must be at this level at this stage, you must be there at this stage, and you go on like that. And proposed length of relationship, maybe 1 year, maybe 2 years, based on what was agreed upon. Activities to be conducted. The expectations and logistics will also be specified. And action to be taken if problems or conflicts arise. Maybe you say that if conflicts arise, we may seek a third person, head of department, to meet with us, or we may terminate the relationship, that kind of thing. And you may have a right to choose another mentor. So you specify all this. So like they say, once things are defined, where there are rules, then you know how to go to avoid trouble. So that's the first stage and takes a crucial part of the mentoring relationship. The next one is the goal setting and the challenges. And then we talk about individual development plans. Again, this is something that's quite difficult for fellows and trainees to take on. They find it difficult to put the ideas together. When Professor Salako became provost in Ibadan, we insisted that all academic staff should have their IDPs, individual development plans. And a few months ago, the director of the Institute for Advanced Medical Research said all those who are connected with the institutes must have individual development plans. And I called her, I sent a text to her that IDPs are usually for mentees, not starting. You don't expect somebody who is retiring in a year or two to now start developing. You already have completed their development plans. You should ask them exit plans. Or have they hand over to people to take over from them. Not that they should be doing IDPs, but it's important that you talk about that. And so you must have this all the time. And you can use a role model. This is a model that you can use. What do you want? That's the goal. What's the current situation? That's reality. What can you do? What are the options available to you? And what will you do? So you then define this. So you have a kind of table with 4 columns, and then you fill all this in. So at the end of the day, you have a working document. So this is the IDP process. I'll take you through this very briefly. So you do a self-assessment, and remember, when we started, we said you do a self-assessment. This is the way to start before you get into mentor-mentor relationship. Unfortunately, we don't do this, because most of the things we do are usually ad hoc or very informal. But in the formal setting, that's what will take place. So you outline your career objectives. What type of work will I be doing? Will I have to be doing? Where would I like to be in this organization? What is important to me in the career? Is it professorship in 10 years? Is it just making money? Or is it the social connection? So you define all this. Then you survey opportunities with mentor. So career opportunities that may be possible, and you select one amongst those that interest you. Developmental deals, needs that you have, current skills and strengths, those needed for a career choice, and then prioritize developmental areas and how this should be discussed with the mentor. So you really taking the front stage in these discussions. Not that somebody is telling you this is where I want you to be. So you are the one leading this activity. Then you then put all these things together. So map out what you want and match your skills and strengths to your career choices. Then revise this based on advice from the mentor. And then put plan to action. That's the last stage. So the crucial thing is to do a self-assessment and be as thorough as possible with that. I think that's very key. Then look at what are the available opportunities, what mentors are available, and which one will fit in, will best make you achieve your plans. Then you then write out your plans and then put the plan to action. What does the mentor do? The mentor is also not passive. Once we are familiar with available opportunities based on what you have. Okay, you need to know about statistics, you need to do a course in epidemiology. Then you may know Professor Igumbor and then contact him. That this is the person that will guide you out. You want to work on NCDs, maybe the person will last will be contacted. That's the way it is. You're going to go to Chicago and you want somebody there to help you. The President Tayo is there to do that for you. So that's the kind of thing the mentor helps you to network. So that is your role. It's okay, this is what you want to do. I think UCT is the place to go. I was once invited to UCT in 2009, a Mellon Foundation Fellowship. And I was asked to come and mentor postgraduate students in their Institute of Aging for 6 months. And I enjoyed that. So that's the kind of thing. Because the director there, whom I had met before, who said I should come. I was there for 6 months. So this is the kind of thing that mentorship helps you to do. So discuss opportunities with mentee, review the IDP with the mentee and then help revise. And then you then go look for ways of monitoring progress. So step by step. And the things dovetail into one another for the actual progress that you want. Then the third stage, because we are progressing. First one is self-inspection, establish a relationship. Second stage is setting the goals. And the major goal here is to develop a development plan. Then this is the phase of hard work on consolidation. And this is where openness, trust, and meaningful discussions take place. And then you can then bring in new perspectives into whatever has been designed based on existing literature. And these are questions, again, that are important at each phase. And you must ask yourself, what are the benefits of this mentor-mentee relationship? If it is not beneficial, then you can stop it at that stage. Or find a way to ease yourself out of it. Or start looking for a second one. Are you being helped at all by the relationship? If it's not, then you can meet with your mentor and say, I want assistance in these areas. We set out in the goals, but we're not meeting that. Can we revise the action plan? And communication is key. Don't root around and say this man is not helping you and you just leave it like that. You must keep talking. That's important. And what changes have you observed in yourself since inception? Have you published any paper? Have you made inroads into craftsmanship? Do you have plans to show for it? Do you have collaborators? Have you been to conferences? Are you known at all? Or you are still in the face of darkness? So you must be able to ask such questions. And then you ask the other question. What adjustments are necessary at this stage? So you keep refining and revising so that you get the best. And look at challenges over time, other priorities, and what are differences that may have cropped up since the thing started. And these are the mentoring tools, especially for research and even career. First one is the development plan, then assigning responsibilities, like writing a manuscript. This is one of the things that the mentor should ask you to do, or should ask your mentee to do. They should write the first draft or write a proposal, and they should be so that will enable them to become the first author, if possible, which is important. They must develop an evaluation tool. If you have a development plan, you must have a way of assessing whether you are doing right or you're not achieving your goal. You may ask the person to review scientific articles. So in that way, they gather experience and can use that to write their own papers. And this is how some of us have learned. You must present at conferences. That's another way of mentoring that is useful. Writing and submission of manuscripts so that their CV will be enhanced. They may be asked to run a journal club, and they may serve on the editorial board of journals. Those are ways in which people develop skills that are important. And at the end of the day, you realize that within a short time, you have so many papers, you are being called to the assistant editor, associate editor of this or that, and you get better. Because the more you review people's papers and read comments that come back, the better you also get. And we all learn in the process. So the last one of the stage is to end the relationship. Nobody wants this kind of thing to end, but at the same time you want it to end because you don't want to be a servant or a slave forever. So you want to also advance. So you have to plan for continued success of the mentee, the networking and collaborations for future studies or future ideas. You must reflect on accomplishments and challenges during the period of mentoring and possible future challenges that the mentee may face. We must explore other funding opportunities for growth so that you have this grant, but there must be opportunity to look for more money so that studies can continue and can diversify into other fields. Then you discuss this engagement. You've been with me for 1 year, 2 years. I think it's high time you moved on. And if the person says, I don't want to move on, then you have a problem in your hands. You have to now beg. Now you have to grow and get out of this problem. And then you express gratitude, and then there may be closure. But like I said, mentorship is really a lifelong thing. Roles evolve, and the mentee must go from a stage of independence to a stage where the person is now completely independent. And that's just a reminder of that. So the preparatory phase, you negotiate to start, then the mentor enables you to achieve your goal, and then there's a closure. And for this to succeed, you look at it like a glass half filled with water. For some people, it's half filled. For some people, it's half empty. So, for a mentor, it has to be half filled so that you look on the positive side always. And that will be possible if there is eagerness to learn, if the mentee is hungry for information, hungry for ideas on how to improve, the person shows interest, is willing to take some risk, is loyal and committed, and shows gratitude. If you don't get this, then there will be a problem. So the key mentoring skills will include listening attentively. This is important for establishing rapport. It facilitates open communication. You trust each other, and so the person can come to you and you can talk. It shows that you are interested in the career of the mentor, and the mentee will also look after your own interests. There must be prompt attention to questioners. Somebody shoots an email to you and takes you 1 week to reply, because it shows that there's no interest. You must reply as quickly as possible. I may be busy, but quickly, this is my opinion, I'm going to reply quickly later. That will be fine. You must develop eye contact. Otherwise, it shows that the person is shy, but the person is not sure. And when you also maintain eye contact, it shows that there is undivided attention. But as a mentor, the rule is please keep your own views and opinions to yourself until the mentee has expressed their own way of what they want to do. Don't tell them this is what I want you to do and take it like that or leave it. No, that's not the way. You must allow the mentee, and that's why it's in red. Please keep your own opinion to yourself until the mentee has expressed their own views. And that's very key. That enables them to develop. You must build trust, confidential information. You must honor meetings and calls as they are set. Don't go late, and the mentee should not be late either. And show interest consistently. And deal with the mentee and with the mentor as honestly as possible. We'll discuss this, determine goals and building capacities. I think we've done this. I'm not going to go again, repeat what I said before. You must encourage and inspire. You must be happy with your mentee's progress and praise mentee. Oh, you've done very well. I'm really excited. Let's keep it up. Next one will be better than this, and you can do more. So, comment favorably on the accomplishments and express belief in his or her capacity to grow, to achieve, so that you tell the person that I know you are capable. Don't disappoint me. Please go now, and that helps to make things work. Provide support when necessary, share your own personal visions, and also talk about others who've been inspirational to you so that they can use that to develop. And also introduce new contacts so that the network grows when you do that. Now, you may be involved in group mentoring. Most of the time it's one-on-one, but sometimes you may mentor a group of people. What I'm going to share are just 2 slides. One on things that we can say that will bring about growth of. These are constructive things that make group cohesion very possible. And the second one will be on destructive things that can destroy a mentor-mentee relationship. So let's start with the constructive ones. Harmonizing ideas. So you listen to ideas from various people and bring them together. So everybody feels that what they are doing is good. So it encourages group cohesion and collaboration. You can sometimes put in a little joke so that things will make things easier for them. Risk-taking, that's where you can venture into new ideas. If you don't take risks, then everything will be stagnant. It's always useful for overall success. Process checking, ensure that what has been done is thorough. Methodology of the study, the process of discussing the results of submitting a grant, and kept to all this. Check that everything is thorough and well done. You cooperate with everybody, you clarify issues, and you inspire. I think if you have these attributes, then mentor-mentee relationship, especially in a group relationship, will always prosper. What are the destructive things? And I'm sure you all know this. These are in red, just to make the point. When somebody dominates the group, he is the only one who knows it. Personal views and opinions, and controls others by use of power and time. They say they will meet at 8, he comes at 9 and says they must start all over again. And nobody can challenge you. That's the domineering attitude. It doesn't help. Rushing is always in a hurry. It doesn't want people to talk. Yes, yes, yes. Next point, let's go on and all that. That really doesn't help. And I'm sure you can identify with this. If you're in that kind of relationship, you want it to continue. Yeah. Then withdrawing. Everybody is talking. They will just sit down and passively just stay there. So remove self from discussions or decision making. Refuses to participate. Of course, people don't trust that kind of individual. And it's either because the person is not interested, or maybe he has other things bothering him. Maybe he has arthritis or something. That's making him concerned about what is going on. Discounting. People say things and say, no, that's not important. Whatever you say is not important. That doesn't help. Digressing. Just tell stories and take people off the point. That also is not useful. And then talking ideas. That will never work because I've not been consulted. That kind of attitude. Or because this is not there. Those are things that block mentor-mentor relationship and must avoid. I have a few cartoons here. This one says, if at first you don't succeed, cry. It will make everyone feel awkward and it will be nice to use the rest of the day. But we know that that's not true. If you don't succeed and you cry, people don't look at you and laugh as well. And pity you that this is a laughing stuff. And they are doing this over a meal so you can see what is happening. And that's the mentor on this side and that's the mentee. So that is not the kind of thing that promotes good mentorship. Now I'm going to show this one again. You can see this is the mentee and that's the mentor. As a baby is carrying the books. He has grown a bit, still carrying the books. Even when they are almost at the same level, still carrying the books. And even there, when they are really at the same level, still carrying the books. So it's a life of subservience. And there are some mentors who are like that. Especially the very old ones. You carry their bag, they must continue to carry the bag always. I mean, he's the one who has the books in the bag. He should carry his books. But culture will not allow you to do that. So, but that's not very good. So this is what is good. See, it must go hand in hand. It's growing, you're pulling the hand. It's growing older, you're still pulling the hand. It's almost like you're still holding the hand. And when it's really like you're still working hand in hand. This is a very healthy relationship, and that's the kind of thing that we should preach. The last one is this one. This is the mentor now telling the mentee. I mean, this is mentee telling the mentor. I'm looking for a mentor who can show me how to get rich without boring me with a lot of advice. So it goes both ways. So, and what I then tell people at this table when I give mentorship is, mentor only those who want to be mentored. If the person doesn't want to be mentored, so be it. Not the mentee telling you that, no, I want to know how to make money. Not you telling me that you must do research, or sleep in the lab, you must do this, you need to carry my bag, and all that. So those are things that was there. So let's quickly talk about progression and transformation. Okay, 46. We still have about 15 minutes. So I think we've said this and we know this. So it's like preaching to the converted. I have 2 hours. I hope I can cover 2 hours. Okay, let me keep going. So the progression in our career, we know that. And this is well set up in the university system. We start as lecturer 2, then become lecturer 1 after 2 or 3 years. Then from there you become senior lecturer after 5 years. And then become reader 3 years later. And then professor 3 years later. And if you are fast, from senior lecturer to professor straight, it's about 5 years. So there is that progression. And this is what we want to see. We want your mentee to go in that linear fashion. And if there's any deviation from the normal path, you must be able to ask yourself, why is this so? Maybe because of ASU strike, the AMP did not meet or whatever, but that's fine. So that's normal. We talked about authorship. When you start, your name will be nowhere. The 4,000 that talked about GPT paper, you'll be looking for your name with magnifying glass. And sometimes you don't magnifying glass. But with time, you become visible. You'll be on the left. You'll be the first author or second on that. And then, as you advance, you become the last author. The fortune smiles on people sometimes. Yesterday we were talking about authorship. Dr. Jai sat there and then talked about a colleague that Professor Massimiliano, Okwechi, is in Cape Town. He said he wrote a paper at one time. He was a very junior person. Unfortunately, they put his name last. So when he got to South Africa, his colleagues were saying, wow, you're a great man. So that's why I would say sometimes fortune smiles on people. So if they claim it, say yes, no matter what I was a junior person, and that helped him to grow. They all respected your question. You have that paper, and all these other people competed with you, and you were the last author. And his name was just right there, and the last person just like that. So this is sometimes what happened. So that kind of prayer that we should have. So it works. So that's the progression that we're talking about. You start from being small, and then you become low. In A&P or promotion balance, we say when you start, you're on the left. That means you are like first author. So as you get older, you must be on the right. If they find my name on the left, then something is wrong. And you must query that haven't you produced people? What do you need this paper for? And so at that time you also look upward yourself. Now why should I want to be in any paper now? It's not helpful. So we must learn that. So another progression is number of grants that we bring and our role in grants, in grantsmanship of grants. When we start, you are like an investigator, probably not known. After a while, you then become a director of project. Then you become a PI or co-PI or site investigator. And so that kind of progression is what we expect with good mentoring, with good success with grants. And then you go from earning maybe $400 per set at the end of the day to thousands of dollars, and you look forward to receiving such honoraria regularly. So that's the way it is, and that's the way people grow. I think there are people who are in academia now who are so comfortable that even despite the non-payment of ASU salary for 8 months, they have enough money to be able to pay their colleagues, and that's because of grants. So if you succeed in this mentoring activity, you succeed with grants, you have money, you'll be a rich person. You can travel, you can do anything. You go to meetings, as Professor Lassie said, because this person is always traveling all over the place. But it's because we work very hard for it. And that's the kind of thing you see as part of progression when you're successful in this thing we're talking about. Then, mentoring. You start from being a mentor and a mentee to the point where you start mentoring people. So that's again the kind of progression. And there's nothing that says that you need 10 years to become a mentor. No. It could happen anytime. So don't delay yourself, don't deny yourself the opportunity to mentor people as quickly as possible. Leadership responsibilities also for progression. You become a leader in a research group when people talk about you. If you're in the lab, you have a lab. When they say this is Professor Ezechi's lab in Naima, and people come there and they will ask themselves, have you worked in Professor Ezechi's lab before? If you haven't, make sure you work there. That means you reach a position of respect and you've accomplished a lot. And you're also a leader. So those are things that add on as we do this thing very well. And this is the stage we advance in terms of skills as well. We start by being a novice, then we become an advanced beginner, then we become competent, later we become proficient, and then lastly we become an expert. And the Society of Gynecology put it very nicely in the next slide, which says that at level 1, the person just observes. This is with regards to residency training. So just an observer, medical student kind of thing. Then you can assist, that's like a house officer. Level 3 can perform activities with direct supervision by a senior colleague. So that's the person is becoming a registrar, senior registrar. Then can perform the whole thing by supervision of a very senior colleague. That would be like a senior registrar. And then you become independent when you become a consultant. And that's the way it is. So you can advance in that way as a form of progression in terms of clinical skills. From the role of being an observer to an assistant to somebody who can work with direct supervision. So we then need very little supervision until we are very independent and become very competent. So again, that's the kind of progression that we have. An easier thing to relate to is to say one is a novice at the beginning, like most of us are. Then you become an advanced beginner. Then you become competent. At that stage, you can do a few things, but not perfectly. Then when you become proficient, then that means you're very good. When you become proficient, that means you're very good, but not at the best. By the time you are an expert, then you are an authority on the field. And so that kind of progression is what we want. So that's the transformation that we talk about. It also goes like this. You can see the way things go with mentoring. Pre-mentoring, one is at this level, then you go on until you get to stage where you can write manuscripts and become an authority, and people start talking about it. So you reflect and think about what you need to do to get to that level. Now, just coming back home, my constituency is the academic world. For academic progress, you need a tripod, the triangle. And so we have research publications, we have grant sources. But you need a third leg. What do you think the third leg is? Mentoring. So we're very correct. So the thing is not stable until you mentor people and people have been mentored. Then the triangle is complete and is very stable. And that's the kind of message that I would like to leave. So these are the research mentoring goals. You want to be a frontline researcher. You must have your research focus. You must be successful with grants. If you can do that, then you're good. You must be independent and be well acclaimed as a researcher. I think at that point your head will swell that you've made it. Then you must publish extensively. Thank you. Because this is the yardstick for measurement in academic world. People say, how many papers do you have? And like the Hungarian professor, 1,500 papers. Can you imagine? That's a lot. We haven't reached that stage in Nigeria. Probably the person with the highest publications is probably about 600 or 700. But nothing says that if you start early, you can't beat that. Nothing says that. So, but you don't need 600 to become professor. In fact, most institutions by the time you're having 30, 50 papers, then you're already qualified as a professor. But the more published you are, the more you are well known, the more collaborators you will get, the more you can easily get grants, the more you can see people respecting you and inviting you to meetings all the time. And you reach the peak of professional career in a record time. So you have accelerated promotion. Those are the things that we should preach if we are successful with our mentoring activities. So what are the metrics of success in research mentoring? Number of manuscripts written annually. We can set a bound that maybe if we can write 5 papers a year, that would be good. Of course, that means a lot of hard work, but to write a paper means it's a lot of data that you put together. And not case reports, but that's the other thing, that people write a lot of case reports. They don't carry as much weight. So it's original research documents. I think 3 to 5 will be good. And like if you go at that pace, in 10 years you will have 30 to 50 papers. I won't be a professor. So that's my own yardstick for that. Number of manuscripts with the mentee is the first author is another metric of success. If the mentee is the last, not the last, if he finds his name in the middle all the time, then something is wrong. It should be the first author, so it should be more to the left. But if by accident they put his name as the last all the time, that's actually better. The most senior person. And we can pray for that kind of accident to occur often. So number of research proposals pending IRP approval. So number of work that you plan to do or studies that you're waiting for approval from IRP to carry on. That's another metric of success. Number of grants won, that's also important. Rapidity of promotion based on research output, not political interest. But some people get promoted because of political lineage and all that. No. But this is based on productivity. Those are the things that matter. Another one is number of invitations to scientific meetings to make presentations. Again, not as an audience, but to actually make presentations. And if possible, be the lead speaker. a plenary speaker. I always hate being invited to meetings to present a poster. I hate it. Because you stand by your poster and you see people just walking past you. And there's nothing more discouraging than that. Or people look at and just see them walking carefully without talking, as if you know them. So, but it is oral. They must be forced to listen to you. Then that's when you've made it. Then number of trainees waiting to join the team. Again, that's a measure of success. You have a lot of people wanting to join your team and you're telling them, I only have capacity for 10 and I already have 11. Then you are there. But where you have capacity for 10 and you have only 1, then they will even ask that one person, why are you still following that team? So these things happen. And then number of patents. There was a part of what Professor Guba said about intellectual property. I presented it before he gave his talk. We in medicine don't worry about patents and all that. But this is where the money actually is. The patents that keep you financially strong. Because you have an idea, you patent it, and it's commercially viable, you made it. I mean, people who make Lyrica, they made so much money that you had an endowment for his university. And Viagra, same thing happened. So if you have a good drug that hits the market well, then you become a billionaire without you knowing it. And we should target that. I know that makes life impossible. So with this, my own slide towards the end. What are the ingredients for successful mentoring? I think dedication and focus is important. Loyalty, respect, high productivity, setting realizable goals, being adventurous, and don't wait for immediate gratification. I think that's important. If you want to make money very quickly, then maybe one is in the wrong profession. Think of things that you grow with it, others will grow with you, and can leave a legacy. Not that you want money very quickly, because money will come and go, and your name will also disappear once the money is not there. There are complex situations in mentoring, and there may be disagreements. These occur from time to time, depending on how strongly principled the participants are. There may be lack of focus, and people are just drifting from one to the other. You come to a meeting like this, they talk about COVID, and so you are interested. Now there's no more COVID, so what do? You then move to the next one, and so you keep drifting and flying around, and that doesn't help. Then stagnation. The mentee is not moving. No papers, no promotion. That creates problems. Conflicting ideas, just that you have disagreements, you also have conflicting ideas. There could be fighting, and sometimes it could be physical. And then there's interdependence. You're going around, the mentee is always following you around, and as if they have nothing else to do but to go around with you. That will also be follow kind of syndrome. So, and then there are personality issues, of course. There are also the financial issues too. Your mentee always asks you for money. Today is this car battery. Next day is tire. And wants you to provide money all the time. Then you lose interest in mentoring such a person. So let's just spend a little time to review 3 cases. Just don't wanna. So we'll just take this and I will invite participation now. Oh, we have microphone. Yeah. So let's read the first one. So let's see what your suggestions will be for this case of professional inadequacy. And I'm going to read the scenario now. Dr. T is a resident who is helping her mentor to prepare a grants application. He's a productive researcher with generally good writing skills, leading her mentor to rely upon her to help substantial the preparation of this proposal. Unfortunately, Dr. T's first draft of the assigned section was below expected standard. While the ideas were good, the elements of the approach were flawed, and the writing style was poor. So that's the first part. From previous experience, the mentor is aware that Dr. T does not like negative feedback. She becomes quiet and withdrawn and loses self-confidence. This has affected her work in the past. The deadline is approaching and the mentor is unsure how to manage the situation and ensure that Dr. T's productivity is preserved and she has a productive learning experience in timely and effective grant revisions. So we have a mentee who used to be good, but for some reason she did a first draft that was below standard. She had the facts, but the approach was bad and the writing style was very poor. But she has this behavioral problem. She does not like negative feedback. She wants to be praised only. She becomes quiet, withdrawn, loses self-confidence, and this has affected her work in the past. But the mentor is also pressed for time. He needs to get in a grant as quickly as possible. In the US, your stay in the university is dependent on your bringing money in to pay your salaries and all that. If you don't have a grant, you can't stay on in the university. So, what should so the question is, what's the best approach for dealing with Dr. T? You have comments? Comments, please. Any of us? Yes. There's a hand there. What will you suggest?
I think issues with withdrawing and losing self-confidence in terms of negative feedback at times could be the approach of the person who is giving the feedback. So in terms of like very maybe nasty or words that are in terms of attacking the person can make one to lose self-confidence, especially if they're trying to build. So the best approach I think is for the mentor to first, because this person has the mentee from previous experience is able to deliver. So at this point, there's definitely something wrong. And one of the aspects of mentoring that we learned is that it's holistic. So I remember Dr. Prof. Njideka, I can't remember the surname. Okay, yeah, talking about expecting a mother to be at work by 8 a.m. in this Lagos traffic and fixing a meeting. I think it's better to inquire what exactly is wrong with the mentee, what are the possible challenges the person may be facing, and based on the fact that they have a working relationship, the mentor knows the mentee. So I think that she or he would have experience of how to really relate and get that information. Without that, it will be difficult to progress and they will be at a deadlock and probably miss that.
Thank you. Yes, there's a hand up. Yes.
Thank you.
Yes, please.
Thank you. Thank you so much, Prof. As a mentor in this scenario, for me the target is to get the grant proposal sent out. So I will call Dr. T and find out what happened, and I'll politely let her know, I think it's a female, that the work is below standard. And for me as a mentor to see that that is a half experience. So I'll let her know that I will sit down and do it together if she has the opportunity. But if not, I'll prepare and send. So I'll go for that having achieved. And my kind of person, I'm going to address her not like negative feedback, because feedback is not bad. So even though it's an academic mentoring, professional mentoring, but her personality, I'll let her know that feedback is good because it lets you see your blind spots. So when we address, that will be the elephant in the room in this case. So subsequently, you are likely to enjoy a better working relationship. Thank you.
Thank you. Yes. Yes. So we just take two more comments. Yes.
Thank you, sir.
Yes.
Having realized the problem of this mentee that a negative feedback tends to withdraw. I think what I would do in such situation is, first of course, she has some area of strength. One could, first of all, praise her strength, and I think that should be encouraged. However, you need to point out where the problem lies, and of course, you know that whenever you give a negative feedback, she feels withdrawn. I think that the mentee she needs to understand that negative feedback is actually not bad. I personally, before, I used to feel bad whenever anybody give a negative feedback about me, but over time, going for conferences with talks like this, I realized that they are not actually bad, they are part of life. The mentee might not know that, so she needs to be told that negative feedback is a part of learning experience, and then one could now provide solution what she should do. And I think with that,
Thank you very much. There is no right or wrong answer. So it's open for discussion. Like listening to Raul, any of these people. So you make your comments and then we'll then have a consensus later. Yes.
Yeah, thank you very much. So most of the contributions that made is some of what I wanted to say. But the last, his closing is to provide solutions. We can see her weaknesses in writing, even though she doesn't know it previously. So identify those and point at things, training program like this that is going to improve her. So those are some of the things that she needs.
Thank you very much. Oh, let's quickly have, and fortunately we have gender balance. 2 men, 2 ladies so far. Now we have a third male and a third female.
Thank you very much. I think from what you said earlier on about the issue of the cup being half full or half empty, I think the mentor needs to put at the back of his or her mind the fact that the way you respond to what someone has done wrong might affect their feelings. So instead of saying, because in the field of psychology, there's this concept of you not saying something is bad, but saying it is not so good. So you must present it in such a way that you acknowledge what is positive, and while you are also encouraging the person to be able to step up to the level in which you want. So instead of saying what you have done is very bad, say it's not good enough, it needs to be improved.
Thank you. The last comment, so that we can get moving. I think all the points are excellent and they are quite right. Yeah, please go ahead.
Thank you so much, Sam. I just want to add that based on the history of Dr. T, that she has a very good writing skill. But this time around, she's not doing the work up to expectation. I would like to know what is going on, because she might have some subtle challenges that is making her to perform below expectation. That's one. Then secondly, after pointing out the flaws in the write-up, I will sit down with her so that we can now package the proposal together. So that's my contribution.
I think all the points made are very correct. You remember that one of the things we said was that we must be able to communicate, we must show compassion and empathy, and that's very crucial. So maybe she's undergoing some challenges, and part of the healing process is to actually look into that and counsel her. But meanwhile, there is this deadline that the person must meet 14 times, and you need money to survive. So rather than waiting to get that right, it may take a while. I think the supervisor must really put together the idea, get the grants, and then teach her what to do in subsequent situations. And of course, she may feel bad, but there are ways in which you can put it like you had said, that what you've done is not excellent, but needs a little bit of credibility. So we look for nice flowery words so that it doesn't feel too bad. So these are concerns in that situation. Communicating constructively with the mentee whose progress is disappointing. You must maintain a balance between positive and negative feedback as much as possible. You want to bring about character change as much as possible. And you can use non-verbal ways of communicating. The Yorubas are good at that. The way they look at you sometimes, they tell you how well you've done. So you have to be careful how you do that. And you have to be sure that message is received without negative consequence. So counseling is what is key after finding out what has pushed her into that. Let's do the second one, which relates to something that you had talked about regards ethics. John was excited about being accepted as a researcher in the laboratory of Professor whatever, a leading scholar in his field, and she embarked on her assigned research project eagerly. However, after a few months, she began to have misgivings. Though part of Professor Adedaro's work was supported by grants from the government, the project on which she was working was totally funded by a large private company. She had known this before coming to the laboratory and institute, but I thought that it would not be a problem. What she did not know was that Professor Adedaro was one of the consultants of the company. John heard from other students that when it came to publishing her results, the company will first review the manuscript. So there are two questions that follow. What are the ethical concerns, and how can this affect mentor-mentee relationship? So I think this one is fairly straightforward. Any contributions, please? What are the ethical concerns here? If any. Because we may not see it as anything, let's please, there is a hand there. What are the ethical concerns?
One thing that comes very clear is there might be conflict of interest which have not been declared, so there has not been full disclosure. So there might need to be a need for her to, in a way, grow to know the full extent of what those conflicts are.
I think that's important. There's conflict of interest, and of course, yes, there's a hand there.
Thank you, sir.
No, you can say that.
Okay, thank you. Apart from the fact that there will be conflict of interest because the professor is working for the company, I think how that will affect the mentor-mentee relationship is likely that the mentor may not give the mentee a chance to express herself freely, to think out of the box, to suggest or do what is outside the interest of this company that the mentor is working for. So the mentor may end up insisting the mentee doing what has to be done for the company. And I believe that we want to bring some confidence. Yeah.
Any other? Yes, there's a hand.
Conflict of interest. If the outcome of that study does not favor the company, it is likely that the company will not want that manuscript to be published.
That's true. There may be a problem of data manipulation and irresponsible conduct of research. That's also very likely here. And of course, the confidence of the mentee in the mentor will be lost. So, and that will be a big challenge for subsequent activities in the lab. And because you're not sure what may happen to you to become the person that blows the whistle and something bad is going on. And some of these issues are worth talking about. And then the third one, so that we can then round up and have contributions from other faculty members. Irene, a professor and two graduate students, have been working on a series of related experiments for a few years. During that time, the experiments have been completed and the work presented at a number of conferences. Now it's time to write up the results for publication. However, an important decision has to be made. They could either write one comprehensive single paper and send it to a very good journal, or they could write a few shorter, less complete papers for journals of less standing. This is called salamization, or slicing of papers. A single paper will provide one single author, while a few shorter ones provide an opportunity for each to become a first author. Irene argues that a single publication as a professor is in a more visible journal will be better, while her students feel that first authorship is more important for their careers. So what do we do? What do we feel, or what do we advise? What will you advise? Yes, there's a hand up there. Yes.
I think that the professor knows best. Up till today, one of my most cited publications is that from my master's with my supervisor. So I did aspects of the work and my colleague did the other aspects of the work. And he pulled it, he made us write independently, but he pulled it together. At the time I didn't really understand what it was about. But Subsequently, I'm really grateful he did that. He was the first author, I'm the second, my colleague is the third. I think it's recently, last year or 2 years ago, I got to know about shared first authorship. So putting this in a journal that is, more significant is better, and they stand a better chance, like you just learned about the global burden of disease. People get excited, and it improves your impact and shows your credibility. So I think Professor Irene would have to find a way of explaining this, but often students may not understand. They just let it be over time, maybe.
We'll put it into figures in a while. Let's get all the comments. Yes.
Just a quick one.
Yes.
As a follow-up to suggestion, I would like to support the Prof's idea that we should publish it in a better journal. That's one. Then since she is the professor, she can be the senior or the last, while the two people share the first authorship. Thank you.
Yes. Yes. No, she wanted to say something. Oh, you are going to say the same thing. Okay. No, you are going to say the same thing. Oh, okay. Maybe we'll have a different view. Wow, good.
Well, I still have the same view with them.
Yes.
I'll just say, at this point, is the best time for the professor to serve as a good mentor to them.
Yes.
And guide them through process of publication and the future and the advantages of publishing in a more visible journal.
All right. Now there's the last hand, and then I'll bring it down to reality.
I will also join others to say that the Prof should advise them to put the paper in the high impact journal.
Okay.
However, the two students, one can be the first author while the second be the corresponding author.
Okay. All right. Thank you very much. Now, in reality in our universities, what matters is the number of papers that you have. In Ibadan, one paper will give you 5 points. So any paper. So supposing you send it to the Lancet, for instance, for science, what you get will be 5 points. Yes, it depends on the university. So I'm giving my own example. Now, if you now have, you can summarize it. Maybe you get 4 papers or 5 papers out of it. So it will be over 25. Of course, if you have hawkish assessors, they will not even give you 100%. Maybe they will give you 80% or something. So even for the big journal, they give you 5. But this other one, if you collect so many. So that's the reality on the ground. But really, if you want to have the right impact, is to go for a big journal and have your paper published. It will be likely to be cited. It can transform medicine. It can be translated. It can do policy issues and all that. But you must also think in terms of the tools and the tricks that will add together to make yes. Yes, please, Professor Ogunniyi.
I think we need to look at everything surrounding the paper. First of all, how good paper or the experiment or whatever behind it. If it's a very good work that will probably be accepted by very big journals, but if it's not a work that can be accepted by all those high schools, then you put it to its level. Everything has a level.
That's a good point. I agree with you. I'll add another caveat in a while. Okay.
Thank you, sir. You told us earlier that we can delay gratification. So I feel that if this publication is done with a more good journal, more people, they can actually get collaboration outside and it can fetch them better opportunities.
You have to weigh the opportunities and all the things, weigh your circumstance. If you need the papers at that moment, you need the points for promotion, you're going to say more. But I'll add something to it that once in Ibadan, again, this is from experience. Somebody published a paper in Journal of Physiology or Journal of Hypertension. And so when they got to A&P, there was a very influential professor who could not be questioned as who was the dean who was making the case for that paper. And he then told them in Senate that this single paper is actually worth 10 other occasions. So these things have to be read, but not these days. I think now no professor can wield that kind of power. If they say paper is 5 points, it can't be more than 5 points. So we need to look at it. Yes.
Yes. Landmark papers that you just need even have to say. Yes. So it's going to be a landmark paper. You don't just throw it with any publish it in like nature and also this. And you're made for life.
So mine is somewhat a question. Are we moving towards citations as a scoring metric? Okay.
The Academy of Medicine Specialty uses that. Most of the others, I think Academy of Science also uses citation. The universities have started introducing that, so there are challenges with that. So there is something that's evolving, but gradually it will become yes, index, all those things are moving to go. Yes, President Zinchi. Yes.
Thank you, sir. My question is, I asked, it is very good for seniors to talk about the publishing assets. Very good. But when people are at the career level where they are faced with, they need to be promoted so that they earn income for their family. It becomes a double-edged sword. You send the paper to last year, it's staying for 2 years. At the end of the day, they come back and they reject it. You start all over again. And you are colleague who is publishing a journal of medicine. Publishes for 5 or 10 and more become an associate professor. And the salary increases. The same institution will come back and see on the college. What's wrong with you? Why are you not publishing? So the person who is trying to do the thorough job, the right thing, and want to keep the rules, becomes the next person. But the same person who is summarizing and then published in any of this becomes the high flyer. So where do we fight? I'm sure most are faced with this challenge now. At the level of the facilitators here, they can afford to say land education and wait. The program I've said is that over 2 years. The QIs will be telling me that they are still looking for people to accept to review. You know, I'm not in a hurry. I can wait for the next 3 or 4 years to wait for it. But when people are at a particular level, they can't wait for it. So how do we strike a balance? In Nama they call it senior people setting high jump for the junior. You know, like you jump here, when you jump across, you now move it.
I don't know. It depends on the circumstance. It depends on how well fed the right time. If you're satisfied, if they bring a little food, you say, take it away. But when you are hungry, you want to quickly eat the food so that you can go to the next door. So depends on circumstances. So these are issues that will face mentors and mentees and can cause disagreement sometimes. What should you do? That this man doesn't want me to progress. It's stagnating me and I want to move forward. So there are challenges that we need to think about. So these are some of the challenges that will go. Oh, sorry, Professor.
Just as a small addition. I think we just need to have it right. Salarizing your papers, you will get to be known with that. I'll give you an example. We're reviewing something and somebody had written reference for 2 people somewhere. And the references were similar. And the people reviewing picked it up and said this was it. You get it? Yes, the same thing, about the same thing for the same papers. And how how does it impact on you to have done it? You get it? So you want to be conferencing with these people when you get, and they recall that you were splitting your papers like Oliver had said. They will not have you will not have that distinction. And so I think it behoves us that have gone through thick and thin and suffered and maybe experienced such to lead you aright. Alright? So that's what I have to say.
I think you're right. And like I said, for all these scenarios, there's no single answer. But it depends on your own perspectives and situation that you are in at that moment. All answers are correct. Depends on your circumstance. Not that I will say, this is what you should do. Now look at your circumstance and say, yes, this is what I will do in this situation. If you're a professor, yes, you go for a good paper. The Americans have another big tool, that one paper, one idea. Sometimes you write massive papers, you have jumbled the ideas together. But if you write single paper, short, straight to the point, you emphasize one particular idea, that's fine. You can use that as an argument that it's better to have a series of papers, and then they can see you are the authority on that. Rather than writing one single paper, maybe accepted after 2 years, may not get the citation that you want. Sometimes they may say it's of interest, it's of local interest only. And when you receive something, publish it in. They will then recommend another journal. Try as of lowest. So all these things you must think about. There are two hands. Let's have their comment. Yes, please.
Okay, thank you very much, Prof. I would like to say that our federal institutions or university generally in Nigeria is not really helping us, because all those high impact factor journals, for you to publish an article there, you have fees like maybe £7,000, $10,000 US. When you convert it to Naira, it's more than my salary for a whole year. You know, so it makes it very, very difficult for you to target. It makes it very difficult for you to target all those high impact factor journals, because it's obtained outside. When you have the paper that is accepted by all these high impact factor journals, you take it to your university. That you have a manuscript that is accepted, and this is the article publication charge, and the university pays. Because in the end, it's going to increase the recommended rating of the university. So in this kind of situation, what do we do?
Apply for grants and build it into your grants. That's the best solution. That's the solution. Just get grants. And that helps. Yeah? Waivers, no, it doesn't work. Sometimes you may be lucky, but most of the time you'll turn it down. Even if it's $2,000 and they give you 50% waiver, still $1,000. It's still quite substantial. And these days I don't get foreign exchange in the banks. You go to the banks, they say they don't have. What do you do? And your paper must the editor says pay with this or something, that will reject your paper. So what will you do? So they are quite challenging. Yes, Professor Ezeji.
My argument to that is that the person have not taken time to look up journals in specialty.
Okay.
For now, in ONG and women's health, I can list all several of the journals and tell you this one's collect money, this one's not collect. Okay. I think we need to go and do a thorough search of all publications in your specialty. Yeah. You will still see enough that you don't need to charge, but you will not be an open access. Yeah. So what you are going to balance, do you want to open an open access? Those are for the big boys now. If you don't have money yet and grants yet, you go for those not open access that also have impact. You publish.
And cited in public.
And cited in public. So when you now become a big boy,
okay. Let's have the last comment.
Thank you, sir. I just want to ask the question. I think we've talked around it before.
Right.
Is it all the time that you mentioned the other time talk of one idea, one paper? Is it all the time when we have a project together that we write it different like salami slicing? No. Because from the case that we have here, it doesn't mean that having it in two ways that the person has sliced. Yes. But I just think that you put the two together, it
can make it richer and yeah. If you look at, and you can Google the Siren, that's the people who been studying stroke in Ibadan. They've published about 80 papers from their study. They have a working group, and they look at hypertension, echocardiography, vegetables, and all that, and all sorts of modeling that they do. So, depends on the way you can manipulate, use your data maximally. I think you need to have a statistician involved in your research group to guide you with various analyses, and that will help you to get the out of what to do. That was the point, okay. So we also round up so that we can then have a little more discussion. So I've summarized a lot of challenges using those 3 cases about research misconduct, effective communication, maintaining feedbacks, gender issues sometimes, issue of loyalty, social and financial burden that may occur, and when to terminate mentoring. Occasionally you have the problem of premature freedom. Somebody who has not yet completed the mentoring process feels that he's already there and wants to be free, as a big boy express or a teacher said. I mean, what do you do to some people? They may have to prove their wings or just let them go and you just see what happens. So this is the summary of what happens in mentoring. And this is a slide that I've taken from what Ogunniyi. This is our usual plan, that you want a smooth path. This is the end, there's a flag saying that this is the end of it, and we'll produce a superstar. But in reality, it never goes according to plan. There are troughs and hurdles and hills along, and we must prepare ourselves for this kind of overcoming all this to be able to go through. So here, there is a valley, you go through there, then you have trees, and you come through there, and maybe pool of water, you're crossing through Lokoja at this time, and you stop there and you have to get to your destination. So those are things that we must think about. But the thing is, at each time, there is a progressive increase in the altitude, and that's what we should aim for. And at the end of the day, we'll produce superstars. So in closing, we know that mentoring is key for rapid professional and academic growth. It is not the same as supervision. Mentoring ensures continuity of excellence, which is what we want, and guarantees succession. And they say if you are walking along and you don't have people following you, it's like just taking a stroll. You need people to support us so that we get to where we're going. But it demands time and commitment, and are we really willing to give this time and commitment to make this possible? I think that's the thing. So in conclusion, these are the things that we expect from mentoring, professional development, encouragement during challenging times, personal development tips, sharing knowledge and life experiences, providing support through life journey, providing resources and identifying how one can get resources, and discussing goal setting and aspirations. You can see that there's trajectory is always upwards. People can do this, then the mentoring exercise is profitable, and that's what I would preach that we should do. I've done a lot of this because I've had unforgettable mentors. Professor Shukuku passed on at age 60, that's 1995. And the person who accepted when I did fellowship in NIH, was young back in 1986, gave me unforgettable mentors. So we need to have such people in our lives, in our careers, to make us succeed in whatever we do. I'd like to thank NINA Research Foundation, Professor Salako, Focus International for all the support they're doing for improvement in mentoring skills in Africa. I've been involved with a few mentoring in PJ, HBNU, WestCat, JBHI. And I've had a couple of mentors and mentees that are notable. And I've also taken a few of the pictures from the internet just to make the talk interesting. I thank you all for
Thank you so much, sir. I was at a meeting yesterday and somebody was describing a notable person, introducing the person to come and speak. And she said that this is an ancestor. in Nigeria. So there can be living ancestors, it seems. So you can agree with me that Thank you so much, sir. I don't know whether we still have comments from the participants. He very graciously took all the questions and answers, so he just faculty to add. There's no anything to add.
Prof. Ogunniyi, thank you so much for that. Truly enlightening, and I really think some of the the points that Prof has really illuminated upon are really important and considerations for us in forging the mentorship and in just the progression and transformation. I also want to kind of just echo the bit of how do we become agents of change in the bit of the ideal that we're seeking for. So the constant reference to this is Nigeria, this is how it's done. It kind of rings true every time we raise suggestions on what would be ideal, what would be nice, really good to have and put in place. So I hope that beyond just taking the notes from this, that we're inviting a whole new ethos around how we hope to apply ourselves in the years to come. Having listened to what the full ecosystem of the research and its rewards and all that should be, and how we then play them through. And that's the one point to make. The other that strikes me too is, at some point we must tell our own stories. We must be the curators and architects of journaling our own stories. So I do want to make a very strong case for more and more support for our local publications. Indeed, we were fully converted in South Africa in that regard, that we try not to and downplay our local journals at all. It's much encouraged to write in the local journal. But there's something I constantly see through, and I think Professor Chi expressed that very clearly with his own anecdote yesterday. You should also look at the topic, what you are writing about, and determine its appropriateness within a journal. The journal is exactly what it says it is. The Scandinavian Journal of Public Health is Scandinavian Public Health. It is not Nigerian Public Health. Right? So it will make sense to send your more localized study that is very much in keeping with the scientific community here in Nigeria as much as possible. Take us to Nigeria and send it to them. There will be certainly lessons of universal interest, something that is cutting edge that you want to share with an international audience. Then you send that out. But when it's something about a study done in Ogbomosho with 2 clinic staff and how you transformed the way they were able to treat patients better, it's not international practice that anybody in Scandinavia would want to read and think and work with. So in that case, appropriately channeling your article to a local journal will be very relevant. Of course, any journal of good work will certainly tell you, oh, this is not within our scope. Focus and send it to somewhere else. But colleagues, at the end of the day, it should be an enjoyable interaction. It should be something we're finding very relevant and that speaks to the work we do. And it truly should not be one that creates too much acrimony and discord between people. You should write and share what you have. And enjoy doing it with your colleagues. It is also a responsibility that we do so. Disseminating your finding into science is actually a responsibility. Don't say, I've done the work, I've passed it on, and I won't share the science. It's important that we do so. I think we've spoken about the need also to join reviewing networks. As much as you are writing as an author, offer yourself to review articles for your journals. That's another area that editors have been calling for a lot of support. That we need good reviewers. Once you've authored 1, 2, 3, 4 papers in the area, do offer yourself to start also reviewing. As you know, it will also improve your writing ability. So those are kind of the most striking things that come to mind as I think of the discussions we've had in the last while. And again, Prof, I would say ancestor. Thank you so much for the input. Thank you, Prof.
Yeah, I think all has been said. Yeah, I'm still learning, like I keep saying. I have learned a whole lot from Professor Igumbor, even though he's my child, but I picked a whole lot from him. Not to talk of our ancestors. I have picked a whole lot. And of course, I have also picked a whole lot from the experiences influence my thinking and how I'm going to move forward with my mentees and mentors, because I still have plenty mentors. So it's always good for one to find oneself in this kind of environment, because we all learn. Clinical trials, clinical research, mentoring, nobody knows it all. We learn from each other. So I thank you so much. I've talking a lot, and I'm still waiting for Babidele to teach me some more. Thank you.
Thank you. I'd just like to add to the fact that always remember that mentor-mentee relationship is built on trust. At every point, please remember that the relationship calls for integrity. Don't cut corner. That can ruin the career of your mentor and even your career and others. The mentor always trusts you that, okay, you go and do this, and that it's going to be done the appropriate way. Don't stretch facts. Report it as it is. People get away with it initially, but down the road, it comes to hurt them. Avoid anything that tends towards plagiarism, anything that tends towards modifying things to fit the story. Because it's not always that the mentor will have to go through the details, one by one, A to Z. Please, even when the pressure is so much on you to modify things, try to stand and resist it. Remember that it is built on trust. That's all that I wanted to add.
Thank you, Prof. Professor, you have a question for Prof. Ogunniyi. Okay.
Thank you, Prof. The first time I met Prof. Ogunniyi, I said, wow, what is this? No, when you are reading Prof. Ogunniyi, I was expecting to see a very old man. And eventually, when I met him, I was asking yes. Thank you, sir. When the time will call you, will always with us. My question is, how do you handle a difficult mentee? A mentee you want to assist, you are doing all possible, or the duty will hand over the duty to you and say, you must put this person out of, and then let him join the path, and you are trying and all you can, excuses, my leg is paining me today, or my husband or my wife is there's always a reason why things will not be done. But then there's a time of maybe paying money or something. The same person will be the person who you now realize is not because of the challenge the person is facing. There is a matter of attitude. So how do you, I'm sure you encounter a lot of things like that. How do you handle it?
It's a tough challenge. No simple answer. If it's attitudinal, then it's tough. And sometimes you might need your mental health colleagues to come in at some stage. I don't want to say psychiatrist. So sometimes you might need that, and you might have to contact psychiatrist. Okay, that's fine. So let's give you. So if it's attitudinal, then you may have to resort to that. But again, remember what I said. Mentor only those who want to be mentored. That's my own philosophy. If you know that this person is negative all the time, it will be like a waste of time. It's like hitting oneself again all the time, trying to help this person. And such individual, you just refer to the HOD or the DG. It looks like this person cannot be a suitable mentee for me because of so. They may be lucky that you find somebody who is also in the same realm or the same space using that word as that person. So that if the person is in the same space, maybe things will work. But with me, I have enough trouble of my own. I don't want to add this one that will not be profitable. So usually I would ask her. You may have a mentee who will also take you to court that you are not doing enough. Again, yes, there are all sorts of scenarios. If you read about all the episodes about mentor-mentor relationship, you will shake your head at times. But the philosophy, don't kill yourself by mentor. If person doesn't do benefit, just say bye-bye. You can try somebody else. And that may work. But what would the psychiatrist advise?
Well, I think in the field of mentoring, from what we've heard, there is the formal mentoring and the informal mentoring. I think it's important for us to be able to try to make our mentoring to be formal. Because if you have an entry point, you also have an exit point, and you have a contract. Because one of the things that we've been exposed tonight is that you might need to actually sign a detailed contract, and you have goals, you have timelines. So if the mentee is not meeting expectations, it's just natural that the person knows that he's dropping off your list. I have a mentor who will tell you that I don't chase anybody. Like, give me a task, don't accomplish it, it is your problem. I don't need it, you are the one that needs it. So you already know how to issue that if you are not meeting expectation, the person works for you from you. So there is no pressure on you. It is you that need to put pressure on yourself to deliver. So the aspect of us, I don't think we should be stigmatizing people and say issues. A lot of people have what motivates them. It might be money that motivates someone, and you're asking the person to do research. You have to, as a mentor, you need to be able to make a map that you will be able to draw the mentee in. Because there's some people when they get money as mentees. But if you are not talking about the money, you are talking too much about the research. You go wondering how will this research lead to money. So I think the mentor also should tell the mentee that this is money on one side. But for you to get money, you have to pass through this process. And if you don't pass through the process, there's no money for you. The person will be motivated.
I agree, and I think those are two. The only part I don't agree is if the person falls short, you say the person should go. No, you have to give the person a chance. If the person then does it repeatedly, and there's evidence that the person is resisting your mentoring activity or advice, then that's the point. But if it's a formal thing, and we started doing that in some institutions now, let the head of the institution know, or the head of the bank, that so-and-so person was a mentor under me, but it looks like the relationship cannot work for so and so reason. Okay? If they find somebody else, maybe that can offer money or something that bring the interest out, the better for that individual. Okay. Thank you so much.
Thank you very much. I was just wondering about if the DG gives somebody go and mentor this person. Obviously, there has been an issue with that person. And the DG has realized that this person needs help. Some of them, there is a lot of poor self-esteem. Maybe because they've been on one for a long time. So they don't even believe in themselves that they can be better. So, if not is to mentor the person, you may need to do some psychology. So that the person don't have to bring up the person's self-esteem that can do this. So maybe start small with the person and don't give something large to go and do. You know, start small and then the person delivers on that small, then you increase and increase. But I think some of them, there's a lot of low self-esteem at work in their lives that need to be tackled before they can come up to that level where we want them to be, in my perspective.
You are correct. We agree with you. No, Prof. Yes, sorry. I think I'm going back to what Suzuko said, this Nigerian thing. For the person's low self-esteem will not get salary. I want to say we are just talking about Nigeria. You have a self-esteem, low self-esteem when it comes to work. But when it comes to salary and work, I think if you are, what I'm saying is that some Nigerians will say, my children will say, no, you should do that. But what I'm trying to say that yes, is I agree, but if you have somebody who you say have a social esteem, but generally is not very forward, even when it comes to money issues, even when what they're telling you to do, you know it's a global thing. You know it's easy to manage. But when somebody, when it is like, assuming you want to go on strike because of salary issues, it will be the person for pushing for it, and yes, we must study institution, they will pay us more. But when it now comes to doing things while you are employed in this institution, the person that developed so that's where I have if it's a global low esteem, yes, it's easy to help that person. But if that person, like a psychiatrist, it's only when you are aware you have a problem, that's when you are now, you know, inside. That means that person is on the way to recovery. But if the person still believes in that division of grandeur, and there's some mentees who believe they really know more than you. You are trying to correct the person telling you this is my specialty. And the person is doing something wrong. So it's actually a challenge and it's going to start off. I think until institution establish this formal mentorship and with clear targets and exit points. So that if that mentee realizes that they cannot keep with this progress, the person leaves. And a lot of people will sit up. But what happens now is that someone can decide to say, I don't care, I'm a lecturer one, and you raise there for until 60 years. And the person says, today I'm collecting salary. And maybe if the person is a medic, he has a shop outside the gate. Where he makes money, he will occupy the space, and he cannot do anything about it.
We will agree with you.
I have a question. Well, informal mentor. So I want to go back to say, let's talk all about it. Let's talk.
Yes, you can. You can have an informal relationship, and then you can
formalize it. There are institutional moves now towards establishing this mentoring process in those places. So somebody who has been an informal mentee can then come in under a formal formal mentorship arrangement. That's possible. But again, if you remember the slide about establishing relationship, you must look at previous mentors that you've had and what benefits they've added on to your career. If you think that that is worth pursuing, then it will be a good thing to do. But if the previous mentorship relationship was not beneficial, then you ask yourself, is it worth wasting another period of your life tacking on to this person? So at each stage, I think we must be able to ask ourselves and be judgmental. Should I continue? Should I stop? What should I do next? I think it's it.
Sir, thank you very much. I really don't want to say anything before, but it has been going inside of me to actually.
Well, then we succeeded. Ideas boil inside people. That's the essence of the interaction.
Okay, sir. How do you escape from a mentor? Okay, the way it is that the person actually said she wants to mentor him, and she's like actually like the top in the department, and for the past 3 years, like I'm not interested. Like she will call me for meetings, for talk. There was even a time she gave me a book of mental health that maybe I need to go and. So she'll be like, you can do this, you can do this. Like, go and read this book. Maybe you don't put your mind together to this thing. But honestly, like, she was one that called me. She said she wanted to mentor me, but for the past 3 years, we've not even written any paper together. Like, and I'm waiting for other people. So I don't know, like, and I don't want to just leave because she's actually like the top in the department and faculty. So what would you advise?
Let's ask you the question. We hope you'll be as open as possible. Why don't you want to that's the way to start. What is against your working to?
Okay, she's actually not in the same discipline as I am. Okay. Like her specialty is yeah, she wants to supervise my PhD. Okay, she wants to.
Yes. Actually, sometimes you can have two mentors. You can have one mentor in your own area of interest. You can have somebody in a different aspect of and it works. So just like you have committee, you can have committee mentoring, like I said, group mentoring. You also have committee of mentors. And we don't need to meet each other. Then you have other reasons beyond service that we don't want that to come.
In addition, before I think of this workshop, another professor in the department actually offered me a PhD scholarship with another person in the UK, one of the people that she was working with. And just to make this formal, she approached her, discussed with her, and she was like, Zoe. Then she called me. And then she was like, I'm not really out to her.
Well, now we are getting to know. I think there's more to it. I think there is more to it. First of all, I think I'll give you a question.
Like Prof. Ogunniyi is saying, I think there is more to this. We don't know all the dynamics. We don't know all the details. We don't know all the undercurrents. There's a whole lot to consider to make comments as regards how we're going to help you. If you understand what I mean. But you have other people in the department or in the faculty, don't you? You can approach those people to kind of help.
She's like the top professor in the
department, but you have other faculty members. The other faculty members, right? Your department, the other department, and their faculty members. Then there are other people to help you. You don't think the other people you can meet
I don't want it to be like I'm kind of reporting now.
No, it's not. I don't know how to. It's not before. If you want to go on with the other research, the other person, you say somebody else offered to okay.
Somebody else offered to assist you, the professor and said, no.
I have to turn down the PhD. I don't want to do it.
That is when you have such, people to be here. If you turn it down, what do you want us to do now?
Actually,
If something arises again, please call other people outside your faculty or your department, other people in your faculty outside your department. To see, there was, I recall when I was I just made a consultant. I was working with Professor Babel, and I wasn't a neurologist. They sent me to a neurologist because that time when you come out, I mean, it was the feedback, and I had worked with him as a senior registrar, and I passed, and then they made me a consultant. Because it was feedback, there was nobody else in this place to run it. And I was in the unit for so long, fighting my own progress. But luckily for me, as we were doing this, we had a new methodology, and they decided that we had to do the unit system. And I quickly moved to my, but after I was in that neurology, I was patronizing with my nephrology. So I wasn't totally out. So what I'm trying to say is that you have to find a way to negotiate your business out. The way it was done, I didn't quarrel with him. I'm still in very good with him, but I still went into my own area. In fact, under neurology, I even supervised exam. Yes, I supervised it because there was nobody else. I said, "Come supervise them." So most and I supervised not stuff because I was the one there at the time, And so we need to learn how to navigate these situations somehow, so that you don't end up quarreling with people and somebody will mess you up in your. That's the idea. You need to find a way to navigate in a subtle manner.
Yes. Hello, sir. On a lighter note, I think the young man have not access to which is high by 6 marks.
I'm telling you.
You need to reevaluate what actually the problem is. We might be talking about it. I think we need to sit down with that mentor and ask him, is your life? And what do you want from me? Clear. And no, I think by the time you reach your PhD position, and you have to leave it. Now, what is it? Is either you leave or you remain there. So I think that it's good to be very loyal and very important. Professionally, mention that when you are talking, nobody else is there. So that is their word against the person. You sit down. And no, I'm sure you might be surprised to see something from when they talk about sexual harassment, they only use it for men. No, it's true. No. The only thing is from Ogunniyi to the female resident. It can be from the female senior police to junior police. I think you need to sit down and look at what you want to discuss and discuss it. Otherwise, another opportunity will come. They will not tell you are not loyal to me. I continue being loyal. So on the latter one, I just want to say so that you actually take the holistic evaluation and actually see how you can be surprised when you bring this as something will pop up. And now you can now say this is not possible. This is possible. There and there you will address it and then yes. And you'll be surprised to sort it out.